asking the right questions and bringing the right issues up. And I'm just really pleased and proud to be part of this committee. So I just wanted to say that. This morning I was thinking about it last night, and an awful lot of committees you go to, people are not focused. They're not, they lose interest at some point. But nobody's lost interest at all through this whole session. And it's been quite a marathon. So I thank you all for doing that. It's been quite a week. We're not done yet. We have edibles this morning. So do we have our hookup with Dr. Bandry? Can you hear us, Dr. Bandry?
Can now.
You can, good. Well, we can see you. You look terrific. All right, so to start our panel on edible products, I'm going to, we have three witnesses this morning. Dr. Ryan Vandry by video conference from Maryland. He's associate professor at Johns Hopkins University. And from the Colorado Department of Public Health and Environment, we have Dr. Daniel Vigil, manager of marijuana health monitoring and research. And from Sensible BC, we have Mr. Dana Larson, director. Now we're going to ask each one of you to make a statement that's maximum 10 minutes long. And then when we're done the three opening statements, we'll ask questions for the next little while. So we'll start with Dr. Vandry, if you'd like to make a 10-minute introduction.
All right, I probably don't have 10 minutes here, but I'll give you the brief version. So I'm a human cannabinoid researcher at Johns Hopkins. I've been doing cannabis research for 17 years now. And recently I've been focused on evaluating the dose effects of cannabis through different routes of administration, including oral or edible cannabis products. We look at the pharmacokinetics and pharmacodynamic effects of cannabis through this route of administration. And we've also done some product testing research where we evaluate the label accuracy of edible products sold in dispensaries in the U.S.
That say on your opening statement?
That's it.
All right, well, we'll have some questions for you, don't worry. All right, now we'll go to Dr. Daniel Vigil, manager of marijuana health monitoring research at Colorado Department of Public Health and Environment. Thank you for being here.
Thank you, Mr. Chairman, committee. Is this microphone on? Okay.
Yep.
So I also don't have extensive opening statements. Happy to answer any questions that you have. I'll just say a few brief things. Concerning edibles, as opposed to smokable forms of marijuana, we have recognized a few different concerns that we think are important to address in policy. One is accidental exposure, either by children or by individuals who aren't aware that the product in front of them may have THC in it. The second is overconsumption, primarily by naive users who aren't familiar with the delayed effects of edible products. And then various concerns of contamination, either with microbials or residual solvents or pesticides that perhaps could be concentrated in edible products. Concerning accidental exposure, packaging and the product forms are very important to not appeal to children, and then child-proof packaging is very important. Labeling is also important, both on the product and the package, to make people aware that it's not, for example, a standard candy bar, that there's something different about it. And then for various potential contamination, good laboratory regulations are very important. So I have plenty of information about some of the data that we've seen, et cetera, and again, happy to answer any questions that you have.
Thank you very much. These are the shortest opening statements we've ever had. So, okay, for Sensible BC, Mr. Larson.
Well, thank you very much. I'll take my full 10 minutes. Thanks for having me at this committee. I've been a cannabis activist for all of my adult life. I run a cannabis dispensary, and I probably sold more cannabis than all the other witnesses combined. And it's good to be here today, but I have to say that I have my doubts that this committee will actually act upon the evidence that is being brought before them in the testimony they're hearing. And I say that because I've been at this a long time, and when I first got started as a cannabis activist in the 1990s, the government was introducing the Controlled Drugs and Substances Act to replace the Narcotic Control Act. And at that time, there was a great deal of testimony and hearings, and about 24 groups came forward, and all of them said that prohibition was a failure, the war on drugs was a failure, we should legalize, end prohibition, approach things differently. The only group that supported that legislation was the Canadian Association of Chiefs of Police and the Canadian Pharmaceutical Association. Everyone else was against it. The government said, we're going to pass this law, and then we'll have a drug policy review afterwards. Well, that review never happened. Canada's Senate took it upon themselves, and they issued a comprehensive and detailed report on cannabis, that 5-volume report that remains probably one of the best analysis of cannabis and cannabis policy today in 2002. That report was also completely ignored, and I would in fact encourage committee members to take a look at that Senate report from 2002 because it is an incredible document. And they recommended legalization of cannabis for all Canadians over the age of 16. These were conservative senators, not a bunch of pot smokers, and they recommended legalization for everyone over the age of 16. That was ignored. The year I was born, 1971, the Ledane Commission recommended decriminalizing cannabis possession and cultivation and working towards legalization, and that was also ignored. So for all of my life, I've seen our government listen to testimony, do research, have studies, talk to people, and then ignore the results. And I hope that doesn't happen here today. The Cannabis Act is a bad piece of legislation. It is flawed in a great many ways. It doesn't even decriminalize the joint that I have in my pocket now that I'm going to smoke after this committee hearing. The idea that we're going to have licit and illicit cannabis and that we're going to have the police trying to decide which cannabis is good and which cannabis is not good is simply not going to work. In cities like Vancouver, where this already effectively decriminalized, we're not going to see much of a change in policy. But in northern areas or First Nations communities or the poor people that are demonized and affected most by cannabis prohibition, you can bet police will be going after them. Where'd you get that cannabis from? That's illicit cannabis. We're going to charge you with possession. It is absurd at a time when we're talking about decriminalizing all drugs that we're still not even decriminalizing cannabis possession under this legislation. Now, I was asked to speak today about edibles, but to me that's a category that's really too restrictive. We should be also discussing hashish, tinctures, capsules, extracts, creams, drops, suppositories, all the many ways that you can use cannabis. At my dispensary, we sell buds and we sell all these other products, and the buds that we sell is less than half of everything that we sell. So when I hear in Ontario they're saying they're going to set up these legal shops right next to the dispensaries to put them out of business, I think, great, it's not going to affect my clients at all. 95% of my customers will continue to shop with me, even if there's a legal shop next door. It's simply not going to have the range of products that are really available and necessary. So as an activist who wants to see better drug laws in Canada, I don't like this at all. But as a business owner, it's great. This is going to keep me and other dispensaries in business for many, many years to come. This will do nothing to shut down dispensaries or affect the black market at all. And, you know, we had a pretty major court case, the Owen Smith case. Kirk Tusaw, who spoke yesterday, was the lead lawyer on that case. And the courts ruled that medical patients have a right to access not only smokable buds, but cannabis in all these other forms as extracts. Health Canada's response was to allow licensed producers to make cannabis extracts with no more than 3% THC, which is a complete disregard of both the letter and the spirit of that court decision. But it's not surprising because that's been the attitude of the government and Health Canada for years. Every time we get a court ruling against to expand the cannabis access, the government and Health Canada takes the most restrictive possible interpretation of that decision. And the result of this is that the government has lost control over cannabis, and they've lost control for many years now. We've been systematically dismantling Canada's cannabis laws for the last 20 years, beginning with the laws against bongs and vaporizers and pipes, which are still on the books under Section 462.2. That law has never been removed, and yet it'd be hard to find a city that doesn't have multiple bong shops in it today. And we did that in the 1990s by simply defying the law, opening up bong shops. There was raids and conflict, kind of like now with dispensaries, but after time, police and communities realized that the war on bongs was a failure, that nobody wanted to see it happen, and they gave up. And as a result, we've effectively legalized bongs and pipes, seed banks, vapor lounges, and we're on the way to doing it with dispensaries and and in many cities we already have. So we're not going to follow these laws, and you're creating laws that are simply unenforceable and cannot you're giving the police an impossible task to do with large aspects of this legislation. I'm currently facing charges for giving away cannabis seeds. I've given away over 7 million viable cannabis seeds over the last 2 years. I traveled to 22 cities across Canada the last 2 years giving away seeds. And I was charged in Calgary in 2016 for giving away cannabis seeds. They've set aside a 3-day trial for me at the end of October. 3 days in court in our justice system that is letting alleged murderers and rapists go because they don't have space in our courts, but they're going to make 3 days for me for a trial for giving away low THC cannabis seeds to those who want them. I believe those charges will be dropped before they go to trial, because what a waste of time that would be. But the fact is, our courts cannot handle this massive civil disobedience campaign that Canadians have been launching, and it's simply not going to succeed. And I would like to remind the committee that the origins of Canada's cannabis prohibition on our drug war is not some well-intentioned effort to protect public health or to protect children, any of that. Our war on drugs, the war on opium, and the war on cannabis began as a racist and ignorant effort to eliminate Chinese people and other racial communities from Canada. That's how it started. There's no question about that. And there's no time since 1908, when the Opium Act was passed, or when cannabis prohibition came in the 20s, and today, when these laws changed from being racist and ignorant and bigoted to being somehow well-intentioned and good for our communities. These laws are bad in their origins, and they continue to be terrible today. The fact is that the war on drugs is really a war on plants. And cannabis may just be the world's greatest plant. There's no other plant that has the nutritional, industrial, social, and medicinal value that cannabis does. But the other aspects of this war on drugs and the war on plants are the fact that coca leaf, opium poppy, psilocybe mushroom, peyote cactus, these are all also good plants with thousands of years of social and cultural use. And the war on drugs is really a war against these plants and against nature, and it's time that it comes to an end. You want to know who to blame for the fentanyl crisis that we're experiencing across Canada? It's you. It's our parliament that has passed these laws that prohibits reasonable access to opiates. The fentanyl crisis is entirely the fault of Canadian policy. We don't have a drug problem in Canada. We have a prohibition problem in Canada. And when we end prohibition, we will see the vast majority of the problems we associate with drug use go away. Cannabis, in fact, is not a problem. Cannabis is part of the solution. In Vancouver, we now have 2 sites that are offering free or discounted cannabis medicines to opiate users as a substitution project. And there's evidence out of the U.S. showing that American states that have access to dispensaries have less opiate use and less opiate overdose deaths than those who do not. So I believe, from my personal experience and from the research, that cannabis dispensaries are saving lives every day in Canada. I know that my dispensary, people tell me, you helped me get off opiates, you helped me improve my health, you helped save my life. This happens all the time. With alcohol also, a lot of cannabis people find when they're using alcohol, they can get off alcohol by using cannabis. Cannabis is a substitution for more dangerous drugs in so many ways. It's easy to regulate edibles and extracts. Give them child-proof packaging. Make sure that the products are properly labeled and the dosages are correct. That's easy to do. It's not complicated at all. And further, CBD should really be descheduled entirely and removed from the CDSA. CBD is highly beneficial. There's no psychoactivity at all. It's an incredibly safe medicine, and there's no question that CBD should be removed from the CDSA and allowed entirely. But the fact is, we can buy enough alcohol, tobacco, or even aspirin. Aspirin you can buy without any age limit at a corner store, and 1 bottle of aspirin can kill you. So the idea that we're treating cannabis so severely and so restrictedly when other more dangerous substances are allowed makes no sense at all, and it really shows the failure of this legislation. So I would urge this committee to go beyond cannabis, to accept that cannabis is a good plant and that prohibition is wrong, to stop handing over this industry to the black market as you've been doing for so many decades, and to recognize that it's not just cannabis, that the whole war on drugs is an absolute failure, and it's time to legalize and regulate and put policies in place that are based on the science. We've had this research for 40 years or more now. We know that the war on drugs is a failure. We know that cannabis is essentially harmless and certainly less harmful than the alcohol or tobacco that is used every day. So that's what I have to say. Thanks for having me here, and I hope that this committee will listen to the evidence presented and make some serious changes to this legislation. Thank you.
Well, thank you very much. We appreciate your enthusiasm. But we're going to go to questions now, and we're going to start with Mr. Ayoub, and this will most likely be en français. So if you need translation, we have translation facilities there for you. So, Mr. Ayoub, 7 minutes.
Thank you, Mr. Chair. Merci, Monsieur le Président.
Thank you, Mr. Chair. I would like to thank you for your great comments from the get-go. It was a long day yesterday. I was a bit concerned to see that my colleague across the way wasn't there for the end of the day, despite the fact that Mr. Carey always asked for more time to question the witnesses, but he missed, unfortunately, a good part of the evening, so I'm glad to see him here today in good form to ask questions. It was interesting to see in all of the testimony that can be widely varied about the scope and the objective of our goal in decriminalizing and legalizing marijuana. It's to protect youth. We need to ensure that it's done well and that our youth who use marijuana in an uncontrolled fashion and when we don't know where it comes from, there's no quality control, and we have no idea about its provenance. And organized crime created it. So today we want to talk about edibles and processed products, and youth can be affected significantly by this. I would like to know the opinion of the people in Colorado on labeling, marketing, packaging, and particularly I'd like to know whether edible products increase, or do you think that they can increase the number of consumers of cannabis products because they're more easily accessible, because it's not something that you need to smoke. Most people know now that smoking for you isn't good for you. There are restrictions, but while eating a muffin, I think everyone eats muffins in the morning, and lots of people eat candy. So I'd like to know your thoughts on this, Mr. Vigil and Mr. Vandry.
Go ahead. If you...
Did you say there would be some translation available?
The translation is right here. I thought you were fully
I'm very sorry.
bilingual. You were listening.
Nobody helped me with that.
So, Mr. President, Mr. Chair.
Yeah.
What happened?
What happened?
Sorry,
That's,
there was nothing
Mr.
here.
Vigil thought he was having full direct translation. He didn't have his hearing. So
there was increased rates of use among youth, and that because smoking is harder to hide than eating, if people will eat more cannabis and have more problems because of that. I think that was the question.
Okay. Sorry, nobody oriented me.
So, Mr. Vandre, did you have a sense of my question? So maybe meanwhile we can go ahead.
Sure, I got the translation here. So you brought very important points up. I think that testing and quality control is absolutely important in any kind of legislation. And the other thing is, what route or how are these products going to be produced and provided, what vehicle? Is it a muffin? Is it a brownie? Is it a gummy bear? Is it a soda? Currently in the U.S. and in Colorado, you have an infinite amount of consumable products, and the appeal to children is certainly important, and I think that that's clearly in the legislation here and is absolutely paramount to anything that you guys roll out. The other thing is how do you test it, right? Is one method of testing for a brownie, can you do the same test in a gummy bear and get accurate results? We don't know the answer to that yet. So I think science needs to be done to validate test methods through different vehicles for these products. Packaging is absolutely important to prevent unintended consumption. So a lot of the problems that happen are, and I believe that Colorado has had this issue, and I'll let Mr. Vigil talk about that more. But you get people who consume cannabis-containing products and they are not aware of it, and then they have adverse reactions and things of that nature. Education about the time course and the delay in onset of effects, the magnitude of effects is key. The other thing that's actually really important also is education about who should or shouldn't be using cannabis. Now, it's in contrast to our sensible BC friend there, it's not a harmless drug. And people with a certain genetic background or family history of psychosis will respond to these substances differently than other folks. People with cardiovascular disease are at higher risk of cardiovascular problems due to an increase in heart rate and cardiovascular stress. So there are very important considerations that have to be considered when you roll out legalization of a drug like cannabis.
Je peux continuer un peu dans le sens que vous dites.
To continue along those same lines, the fact that we're doing this in steps, because currently the regulations have not yet explored edible products exhaustively to put them to market, but perhaps that might be a subsequent step. Do you think that taking a step-based approach is a good one?
The step is, right? So without seeing exactly what you're talking about, it's hard for me to comment on so if you're going to legalize smokable products and vaporization products first and then broach edibles, it all depends on what you ultimately do with edibles and whether or not there's any public health benefit or harm of ingestible products versus inhalable products. When we're not talking about medicinal use, it takes on a different context. And so the thought process needs to be a little bit different. And so that's the challenge here. So in the context of medicinal use, edible products is easy. You put it in a gel cap.
The question is this more dangerous than smoking? More easy? The access is easier to have to eat edibles than smoke pot?
If it's sold in a store, access is the same. I don't think it's any more or less. The access to the product is going to be determined by how retail sales happen. And so if you're selling smokable products right next to edible products, it's the same. There may be some perception of less harm with edibles versus smokables due to pulmonary concerns. But there's no science
to stop you there, I just want to have the answer from Mr. Vigil.
Sure.
If you can give me a short answer.
Sure. So in Colorado, we see a small portion of marijuana users who use only edibles, but the vast majority smoke. And this goes for adolescents, high school students as well. In our surveys there, the vast majority, their primary mode of use is smoking, and we don't see a large portion who are using vaping or edibles. Sort of the thought was that, as you maybe alluded to, it's easier to hide that and to be doing it during school, et cetera. And aside from a small number of cases, that isn't something that has been widespread.
Okay, time's up. Ms. Gladue, 7 minutes.
Thank you, Chair. And certainly, I think you did a marvelous job yesterday when we had all of our long sessions. Thanks to all the witnesses that are here. I don't know a lot about edibles, so I'm going to try to learn something from you. I've heard a lot of discussion that we should only be allowing edibles that don't appeal to children. But the only edibles I've heard mentioned so far are cookies, candies, gummies, cakes, milkshakes, suckers, and brownies. So my question for you, Mr. Vigil, is what are the edibles that wouldn't appeal to children?
That's a very good question, and I mean, I don't have a clear answer for you. I think packaging is very important because along with education to not leave cookies outside of a package laying out that would obviously be appealing. The types of packaging that a child might want to really get into is important. In Colorado, we had to put in place some regulations sort of after the fact, and so it's it can't be in the shape of humans or animals or fruits, and so that's a start. But where the best line is ultimately is difficult.
Thank you. That's fine.
Sure.
Okay, so in terms of how much of a dose is reasonable, I've heard conversation that people sometimes take too much because of the delay time. So what is the delay time, and how much is a reasonable dose for a person of X weight? Mr. Vandry.
So the delay in time, typically you have an onset of effects after an edible of about 30 minutes. The peak effects happen about an hour and a half later and are sustained until about 3 hours after administration. Total duration of effects will last about 6 to 8 hours. That duration is determined by the dose. Now, exactly what a unit dose is an important question. In Colorado and in other states in the U.S., it's been established at 10 milligrams as a maximum dose, but lower doses are available as well. And it's going to be different from across individuals. Now, body weight isn't necessarily the important characteristic in terms of defining the effect of a dose. There are differences, there are sex differences in response to cannabis where females tend to be more sensitive to its effects than males. And so I don't think that there's enough data to determine what a real, what an appropriate unit dose is. In my lab, we've tested 10, 25, and 50 milligram doses in healthy adults. 10 milligrams produces a drug effect without a lot of impairment, but again, that's healthy young adults. And someone who's 65 or 70, that may be different. Someone who has a certain genetic predisposition where they metabolize the drug differently, that may be different. So again, my studies have been done with a total of 35 people. So it's hard for me to say exactly what that right dose is. Colorado uses 10 milligrams, and perhaps Mr. Vigil can talk about any issues that they've had with that unit dose in Colorado.
Before we go there, I want to ask you one more question. So one of the concerns we've heard about home grow is that there's no quality control. And so the potency can be different. And so if you're baking your brownies at home from your home grow, is there any experience that you have in the relative percentage of overdoses that we see or problems that we see with that?
Well, the issue there is you have to test the product that you're using to make the brownies or whatever it is that you're making. You have to know the potency in order to determine the dose that you're putting into the product. The other thing is you have to either make each individual brownie with a known amount of cannabis, or you have to have some kind of manufacturing process to ensure even distribution of the drug throughout a batch. You can't just throw cannabis in a brownie sheet, cut it up, and expect the same amount to be in each brownie. So, I mean, there are clear manufacturing practices that have to be put in place, testing practices. Now, home grow doesn't have any of that. You know, your home grow person is not going to be testing the potency of their plant material, testing each individual whatever it is that they make. So, you know, that's a crapshoot in terms of dosing. But
Absolutely, out of control.
My guess is that you're not going to roll out at the national level open retail sales of homegrown product. There need to be standards for manufacturing, production, and testing.
I would hope we wouldn't even allow it because of the hazard for the people in the home. Mr. Vigil, do you have any experience from the Colorado timeframe about people in the home grow? Because I know you did do that.
Right, we do allow large amount of home grow, in particular for medical patients with an extended plant count. And unfortunately, our data is not able to distinguish whether a poison center call or an emergency department visit was related to homegrown or store-bought. I would certainly agree with Mr. Vandry that a regulated market is going to be safer from that standpoint. I think those individuals who are growing at home and making their own concentrates and edible products are very likely fairly experienced with it and less likely to get into problems with having too much. And then I think the last point that I would want to make is that it's where is the product that more naive users using going to come from, and the more availability on a regulated market, I think the less likelihood you have of that product coming from a black market where it may be much less clear what's in it and potentially more dangerous. So.
And do you have statistics on any of the medical calls resulting from edibles or overdoses from edibles or anything from Colorado?
Yes. So we have seen an increase in poison center calls and emergency department visits related to marijuana following legalization and even somewhat prior with commercialization of medical marijuana. In the poison center calls, we are able to distinguish edible versus smokable. We can't do that right now in the emergency department visits. And for adults, about half, it's about equal numbers, edible and smokable products, which is actually disproportionate because more product is smoked in Colorado. So, so there is some increased concern with edibles.
From relatively from,
right.
Edibles.
And then, of course, with children 0 to 8, it's the majority are edible products.
Thank you.
Is it possible that people are just more comfortable going to a hospital and saying they used cannabis when it's legal than it was beforehand? That maybe there's not an increase in actual overdoses, but simply, or like people taking too much, but simply an increase in people who are then going to go to a hospital and talk about it, whereas beforehand they could be criminally charged if they say I was using cannabis or somebody. Is that a possibility or something that you've looked at?
Is it okay to?
Sorry, I just thought I'd toss something in there, but.
Time's up. We have to go to Mr. Davies.
Thank you. Mr. Vigil, I think one of the premises of our question is that if we don't legalize edibles, that people aren't going to be using them, manufacturing them, selling them, or distributing them. That's not the case, is it?
No.
No. So it's unlikely to me that whoever is producing those products now, particularly, let's say if there's criminal elements, it's unlikely that they're producing edibles in child-proof packages. Would you agree with that?
I agree, yes.
Yeah. So I take it, and the task force, the Canadian task force that looked at this recommended for a number of reasons that this government legalize edibles, concentrates, and other non-smokable products. Precisely for those reasons, I guess, and I think it's what you're saying, if I have your evidence correct, that it's better to regulate those products so that we can try to control dosage, child-proof packaging, single-serving, stamped products to minimize the harm. Is that, do I have that correct?
Yes, that's correct.
And so Colorado, after, we did hear evidence that Colorado initially legalized edibles, had some problems with it, understood the problems, came back and brought in further regulations on edibles. Is that correct?
That's correct, yes.
And how's it working now? Have they addressed some of those early concerns that originally happened from the legalization of edibles?
Well, in our most recent year of data for both poison center and emergency department visits, we have had a slight decline. So we hope that that's related to regulation and public education. We can't be certain what the causes are, but we have seen a slight decrease and hope that continues.
Mr. Larson, you sell products. Now, by the way, when we talk edibles, again, I think we're talking, all I hear is brownies and gummy bears and whatever. You described a range of products that this C45 would retain would still be illegal. You mentioned creams, sprays, tinctures, patches, tablets. These are all forms of cannabis that C45 would continue to remain illegal. Can you tell us, in terms of the products that you sell, are these products unsafe? Are you finding, do consumers want them? What percentage of your users prefer these products as opposed to smoking cannabis?
It's probably about 60-40 like the extracts towards over buds. Of course, there's also smokable extracts as well, hash and shatter and things like that are also very beneficial but are used in a smoked format. But I think people are more inclined to use edibles and that when they know it's a safe amount. People do not want to ingest vast amounts of THC and hallucinate. That's not what they're looking for, right? That's why people tend to smoke, is because it's easily titrated. You have the amount what you need and then you're done. And with edibles, it can be a long wait. But edibles can be very useful for pain relief and for long-term, longer effects, especially medical users who don't want to be smoking constantly. They find the right dosage with an edible or a suppository, by the way, which is an incredible way of using cannabis, very low psychoactivity, good to get a high dose medicinally or otherwise. And when they talk about legalizing, we're going to sell it in liquor stores. I think you're going to sell suppositories and cannabis suppositories in liquor stores. We sell a cannabis cream called MJ Creams. There's no psychoactivity at all. You rub this cream on your skin. It's great for psoriasis and eczema, great for topical pain relief. This could be put on a baby or on anybody of any age. I don't see any reason to have an age limit on a cannabis-infused cream that has no psychoactivity. And so I think we got to broaden the range of things that we're looking at. And at our dispensary, it is very rare for somebody to come back and say, I took too much of the edible and I had a bad experience. We tell people, like doctors do with prescription drugs, start off with a lower dose. If that doesn't work your way up to a higher dose, try a little bit more at a time until you reach the point where you're getting the effect that you want, and then you've got enough. And if the government's not going to allow edibles and extracts, we're going to continue to sell them through dispensaries, through the black market. They'll be unregulated, but we do our best to make sure these products are safe and labeled, and given the constraints of legality, we do our best. And I think we do a pretty good job already. And a lot of the fear-mongering around edibles and extracts simply hasn't materialized in Vancouver or Toronto or other cities that have dozens and dozens of dispensaries. We're not really seeing a lot of problems coming out of this, and that's an unregulated, self-regulated market. If we have some proper rules in place, problems will be minimal.
I think Mr. Ayoub put it well. He talked about we want to limit the use in uncontrolled fashion of products of unknown provenance, and I think. Mr. Vandry, you referred to it as a crapshoot. I mean, would we prefer to keep this legal and have Canadians cooking their own edibles in their own kitchen?
Toronto or other cities that have dozens and dozens
of the THC, for instance, in a tray of brownies. Like I fail to understand how that's a preferable public policy approach to edibles than putting it into the hands of tightly regulated market and sold in retail fashion by people who can be advising the customers, as you just point out.
People are going to make their own edibles anyways, even in a fully legalized market. People enjoy making their own edibles. It's fun. It's like growing your own cannabis. It's an enjoyable activity to grow a plant in your garden, then harvest it and use it. People like that. Tomatoes or zucchini or cannabis, people enjoy that. And people are going to make their own edibles even under legalization. Most won't. They'll go buy it in a store because that's easier. But people brew their own wine, they make their own beer, and there's no somebody coming in saying, we're going to check the alcohol level of that beer and make sure it's at the right level. That doesn't happen. And so I think a lot of these concerns are overblown, but I would prefer to see a legally regulated market that's open and accessible for regular Canadians to enter, like it is with other products. But until that day happens, edibles will continue to be available. Extracts will continue to be available. We sell pure CBD tincture and pure isolate of THC and CBD at dispensaries. We're years and years ahead of where the legal system is going to be, and you got a lot of catching up to do.
C45 legalizes dry flower and oil, but I'm not quite sure what that oil will be used for. So what's your understanding, Mr. Larson, of the oil that will be legal under this bill? How will people use it, and can it be vaped?
My understanding is this legislation is only, it's 3% THC is the limit that licensed producers are able to make for their extracts, and I think this is the same thing. So I think there is going to be a lot of problems with this. Vaping is very positive too, by the way. If you have concerns with people smoking, and those concerns are often overblown, but vaporizing eliminates most of those concerns. There's no particulates. It's purely just the active ingredients steamed off the plant. You inhale them. It combines the benefits of smoking, which is a quick action and being able to get your dosage precise without having any smoke involved. So I think vaping should actually be encouraged and be considered a better way of using it. And I really feel that under real legalization, which would mean that Canadian farmers are able to grow high THC cannabis by the thousands of hectares, that is what we're working towards. And when that comes, smoking buds will be less popular, but you'll be able to make extracts of pure THC or CBD or CBG or CBN or the other cannabinoids in any combination you want, and vaporize or use those in a way that I think will be revolutionary and much, much safer than what we're doing now.
Much time is up. Now we go to Ms. Sidhu.
Thank you, Chair. Thank you all being here. Lots of new learning. Never heard about that before. My question to Dr. Wendry. In your recent study on edible products and labeling, you said only 17% of edible products had accurate THC content listed, while 60% were overlabeled. Sorry. What makes accurate labeling of THC content in edible products so challenging? Is it a result of lack of regulation or producers not having the resources of accurately providing that labeling?
I think it's a combination of the manufacturing practices not being careful enough to put a precise amount of product in each package or in each dose, as well as difficulties in the lack of standards for testing those products.
Thank you. And you said education. Who should be or who shouldn't be using? You also mentioned the cardiovascular stress on the cardiovascular patients. So high THC or low THC mean something, or what type of the education tool need to be providing?
Well, I mean, I think broad education needs to be disseminated regardless. But in terms of THC content, you know, you have to define a dose, and the dose depends on the individual and the reason they're using it. So, you know, right now we're talking about non-medical use. So you have people looking to get intoxicated is my presumption here. So you're likely talking about doses that are higher than what would potentially be needed for medicinal uses. But at what level that is still kind of up for debate and in need of more research. So as any good researcher will tell you, we need more research, but the fact of the matter is there are very few controlled studies of edible dosing with cannabis. And what we've found in our laboratory is we can give the same dose to 35 different people, and half of them tolerate it very well, and the other half get severely impaired. We have some individuals vomit after a really high dose. They consistently get sick when we vary the route of administration. So it doesn't matter as much if they smoke it, vape it, or eat it. At high doses of cannabis, they get the same types of effects, and some people are more sensitive to those effects than others. But again, drawing a parallel with other things like alcohol, you can say the same thing. Some individuals can drink 6 beers and be fine, and others would be throwing up in the corner. So, you know, how you manage that and how you factor that into regulation is you want a unit dose that's low enough that's not going to make most people sick. And let the people that can tolerate higher doses consume more, but do so in a manner that that they know what to expect, and it's consistent across episodes of use. So when you go to the liquor store and you buy a beer, the beer isn't 5% alcohol one time and 10% the next if you're buying the same beer. Now, there's a variety and differences in beer, but it's labeled with the alcohol content on there. And you need a similar setup for cannabis.
And I heard the Colorado using 10 milligram. Is there any way to assure the THC doses are evenly distributed?
So again, Colorado has their system for evaluating and testing those products, and they put the ceiling on there. I'll let Mr. Vigil talk about that process, but as long as you get consistent dosing of 10 milligrams there, and we did not do our testing study in Colorado. It was conducted in California and in Washington State, and that was also conducted only in medicinal or medical cannabis dispensaries, not non-medical retail. So, that was also done several years ago. I don't know where things stand now, but I think that there needs to be a quality control regulatory agency in place to monitor this stuff and to make sure that things are accurately labeled and that the dose is appropriate and all of that. So quality control is imperative.
Thank you. And my next question to Mr. Vigil. July 2016, Denver Post published a report on 5-fold increase of children's admission to hospital due to ingestion of edibles. So how we can protect our kids? What are the challenges with the packaging? Or we should tell that the kids don't attract those packaging. And what about the food safety? Do you think other jurisdictions combine edible production and food inspector in regulations?
So first concerning children and edibles, to answer an earlier question, the hospital data is a mix, I think, of causes. One is likely some increased exposure, but there's also very likely an increase in willingness to admit to exposure or use. And so, of course, we've mentioned childproof packaging. That's very important, as well as education for parents that this is not okay to leave out, and it can be dangerous if children are exposed. Keep it in the childproof packaging once you get home, and then for appeal. Again, that's not something that I can quickly, just give you a very clear answer on. I think it's very important to come up with good guidelines there, balancing the fact that people want these products, people want a variety of these products, and if restrictions are too limiting, then you'll see products that are outside of the regulated system. So it's a tough balance, and I don't have the clear answer for you on that. Can you remind me your last part of the question?
The food inspector.
Oh, yes. So I think that varies from state to state. In Colorado, any edible production falls under the general food inspection that they do for kitchens that produce any products that go on the shelves. So they are subject to the food safety inspections. In addition, all marijuana products are required to be tested for content of THC, CBD, other cannabinoids, and for any microbial contamination, pesticides, and residual solvents.
Time's up. That completes our first round, and now we go to our 5-minute round, starting with Dr. Carey.
Thank you very much, Mr. Chair, and again, a great panel. Thank you all for being here. I wanted to get right to my questions because we do know that this is rolling out in 288 days. There's not a lot of time, and I think it's a really missed opportunity. We had Colorado here earlier saying that really before you get this rolled out, you should be having your public education program in place, really good factual information. We don't see that there. Data collection should be in place, treatment research, things along the lines. And for the last 2 years, really, the Liberal government hasn't really been doing anything. And again, we're jamming all this into 1 week. And I just want to particularly thank Mr. Larson for being here. I think you're the first person we've had that's on the ground actually integrating and talking to the public about this very important issue and transformative piece of legislation anyway. So I'm going to throw out all my questions, and I'm going to throw them out all to you because I only have 5 minutes. And I've got, I think, 4 main questions I'd like you to answer. First of all, there's a lot of questions about cannabis by parents, educators. What do you do for your clientele for education? And when they have questions for you, do you have scientific, basic pamphlets, things along those lines? Where do you get your product? How do you assure quality control? And I'm curious, what would you say a good age cutoff would be? And I'm not talking for medicinal use, I'm talking just for recreational use. So those are 4 questions. I probably only have 4 minutes left for my time. Would you be able to comment on those 4 questions, please?
Can you give them to me one at a time again so I don't forget all the questions?
First of all, what do you do for your clientele as far as education is concerned?
Okay, I'll just take, so for that one, it depends what they're coming in for, but if we try to guide them to the right product, sometimes people come in, they're experienced with cannabis, they've used it a lot, they're just looking for a particular product, they don't need a lot of guidance. We also get senior citizens who come in, say, I haven't used cannabis in 50 years, my grandson says it'll be good for my arthritis or something. We don't typically stick a joint in their face, we normally give them edible products or CBD-based products or creams or tinctures or things that are going to have less psychoactivity and more of a medicinal effect. So we try to guide them based on what they're looking for and what their experience is. And like other things, we always tell them, start off with a small dose and then work your way up until you get to the point where you're getting the benefits or whatever it is that you're seeking. So that's the kind of guidance we try to give.
It's like written type of guidance?
Mostly oral. We have some written information and pamphlets and things like that too. It depends, but a lot of it's just personal conversations with people and a one-on-one discussion, like you'd have with a pharmacist or a doctor looking for guidance on cannabis. Sometimes they have a doctor's advice going in, but Canadian doctors don't really know a lot about cannabis or the endocannabinoid system, which is part of our body system that the cannabis interacts with. So
do your
mostly
employees have training?
Yeah, we try to give them training. It varies, but we make sure we talk to everybody. And if they can't answer the question, we make sure we have somebody there who can.
Okay. Second question, where do you get your product?
It's from the illegal market. By definition, we have no choice. There's no legal place for us to get it. Some of them are people that have been growing cannabis for years. Some of them are licensed under the medical program to grow their own cannabis, and they might have some extra that Health Canada wants you to destroy it or just dispose of it if you have too much. Well, they dispose of it by selling it to a dispensary. There are many people that make edibles and extracts and things at home, and a lot of them don't meet our standards. The majority of what gets brought to us we reject because it's not the right quality or doesn't meet our needs. But it comes from the black market by definition, but we do our best to make that the lightest shade of gray it can possibly be.
2 more questions. Again, you were talking, you reject a lot of it. What do you do for quality control? And then a really important question I'd like your opinion on age. Okay, for recreational use, what do you think a cutoff age would be?
Sure. Well, for quality control, it's a challenge because we're not able to access Health Canada certified labs. They will test our cannabis if we have someone who's legally allowed to possess, send it in. But if I put on my website, this lab tested our cannabis and here's the results, Health Canada will call that lab and say, you're going to lose your license. You can't test dispensary cannabis. So I can put out whatever results I want, but only I know if I'm telling the truth or not. I can't tell you which lab did the results. And so that leaves us in a very difficult position. We also do our own study. The first thing we do when we get raw buds into our dispensary is look at them under a microscope, and I would encourage members to do the same thing. You can see a lot in terms of mold, mildew, the quality of the trichomes, the resinous glands, if they're there, if they're ripe. That's just the first step. If most of it doesn't pass that, then we will do a taste test on it. Someone will smoke a little bit of it. You can tell if there's chemical contaminants, if it's been over-fertilized. Then we'll send it to a lab if we can, and then after that, if it meets all the standards, we'll put it on our shelves. And with edibles and other products, we've actually found with edibles, we typically supply our producers with our cannabis or with an extract. So we know they're getting a standardized amount, we know where it comes from, and we can give them the same strain or a very similar product to help them standardize what they're making. And a lot of edible makers don't use raw buds. They will use an extract, so they can make something of a known potency and then put that into their product, helping them to standardize the dosages. As to age limits, if I was in charge of the world, I'd make it 16 years old to buy cannabis from a legal place. That being said, I'm happy with the limit being the same as alcohol. That's not a problem. But one thing I see lacking in this legislation is there's no allowance for a parent to give cannabis to their child. You can give alcohol to your children at pretty much any age. A lot of young kids have a half glass of wine with dinner. We don't criminalize those parents. But if that parent were to give their children cannabis or share a joint with their 17-year-old child or something, they could be criminalized and face some serious repercussions. So that, I think, is an issue. To me, the use of cannabis by youth is a family issue and should be determined at the family level. And this legislation doesn't allow for any sort of family decisions on that, which I think is really a big problem.
Great help.
Thank you very much. Thank you for the questions. Now we go to Mr. Carey. Mr. Oliver. We'll get it.
Thank you, and thank you very much for your testimony. This is our last day of a full week of testimony on this bill, and from people in the industry and consumer, well, from different walks of life on it. By the end of this week, we'll have heard from 100 or more different witnesses. So it's been quite excellent. If we'd done this in our normal process, we would have been at it for about 3 months. This has really allowed us to delve deeply into the issues, and it's allowed us to compare and contrast testimony that's often difficult to do when you have it stretched out so much. So edibles is the one that I think when we come to clause by clause, it'll be one that we're really reviewing. I think edibles right now are excluded from the legal definition of marijuana, so they wouldn't be permitted. So I'm just going to give you what I've heard in terms of the pros for including and the cons for excluding, and just ask if there's anything that I'm missing in the analysis of it. So on the positive for including edibles, I've heard public health, that otherwise we're encouraging smoking and ingesting of cannabis through smoking. Edibles give you a healthier alternative for ingesting cannabis. Second, I've heard is that if we don't bring it into the legal market, then it really does allow the black market or the whatever market to really continue and grow in that particular market space. And I think Mr. Larson spoke to that quite pointedly. Those are the two reasons I've heard for inclusion. On the reasons for excluding, I've heard this is a social change, a social experiment for Canada. Go slow, see how what you've got is working before you push on to greater market. Kids access seems to be, and kids accidental ingestion seems to be higher with edibles than with products that you need to smoke. It's hard to regulate and hard to inspect, and there's more complexity in edibles than in the sort of more raw plant. Although with the work in Colorado that they've done, I think there's some pretty good and easily adapted regulations that are in place. And the fourth point has been, what the heck? It's easy to make at home. If people want the edibles, they can go get them. So those are the sort of the pros and the cons. Is there anything, I kind of rambled through them quickly, is there anything else you think I should know as we're thinking about the pros and cons of edibles? Anything you'd add to those lists?
Excuse me. Just a very slight clarification on your first point. With edibles, you do avoid any of the possible pulmonary effects of smoking. There is one concern that I think is a little bit greater with edibles, and that is driving. And the fact that with an inhaled product, you can quickly recognize what the effects are and give yourself time to overcome those effects or to get back to a safe place to be driving. But with edibles, it's possible that you would not realize that you haven't felt the full effects and potentially get behind the wheel. So that's...
Duration and speed of the digestion is different.
Right. It looks like Mr. Vandry has something.
Yes. Just go ahead.
So in the laboratory studies that we've done where we acutely dose people with different routes of administration, I think it's important to note that when we give people smoked cannabis versus edible cannabis, the magnitude of drug effects and the types of effects are identical. It's really just the differences in the time course of the effects. So I have not seen any evidence that eating it is more dangerous than smoking it. Nor I would disagree in the argument that you can't perceive the intoxication when you eat it. People are very aware that they're intoxicated. The challenge is in detecting edible cannabis in a driver who's impaired versus not, but that's a problem across the board, independent of route of administration, but is a little bit different in edibles in that you get lower blood concentrations.
So just quickly, would you recommend, one by all three of you, would you recommend Canada include edibles in their allowable, or would you support the slower pace that's been proposed in the legislation? Just if you want each to address it, Mr. Larson.
I support adding edibles and also other extracts as well, hashish and all those kind of things, both smokable and edible. That's got to be part of legalization. You're really only allowing the buds is missing out on a large portion of this, and yeah, so I absolutely think this should be included. And I don't, this go slow thing. We've been going slow since 1971. It's time to act and not to go slow.
Okay. Mr. Vigil?
I think ultimately they should be included, but it's very important to get it right, and you know, if that takes some time and some learning from the smoked market, then I would be in agreement with that.
And sir, Dr.
Yeah, sure. My personal recommendation would be in favor of regulation and quality control over all products. I think that's in the greater public good, rather than just allowing one version and then continuing to have black market product available that you don't know what's in it. I think that makes the most sense.
Thank you.
Thank you very much. Now we go to Mr. Weber.
Thank you, Mr. Chair, and thank you to the panel. My first question to Dr. Vandry. As a cannabis researcher, you mentioned that you evaluate label information on products to determine whether they're accurate or not. That is correct. In Colorado and Washington State, the licensed producers, have you found that their labeling is quite accurate?
So again, I've not conducted any testing in Colorado. The state of Colorado does their own testing, and maybe Mr. Vigil could talk about the outcomes of what the tests is that they've done. The testing that I've done in Washington has been limited to medical cannabis dispensaries, which at the time were distinct from non-medical testing dispensaries. I believe at that time that the regulations over products being sold in medical cannabis dispensaries were not very rigorous, and the testing that we found there indicated that most of the products were inaccurately labeled.
Interesting. Mr. Virgil, accidental exposure that you mentioned in your remarks about incidences, do you see a lot of that occurring in your neck of the woods?
So the term "a lot" is I think important to comment on because we have seen an increase, as I mentioned, in both poison center calls and emergency department visits relative to other reasons that people are making those calls.
I'm referring specifically to accidental exposure.
Okay, right. So
children.
Right. So let's focus on the 0 to 8 year age group for accidental exposure, and so poison center calls, about 1 in 10,000 children at the peak in Colorado. There was a call related to marijuana. I'll also mention that that outcomes were not, there weren't severe outcomes related to that. It was the majority of those were just some concern.
Through ingestion of an edible?
Right. Well, so some portion of those were smokable. Children can pick up a bud and put it in their mouth as well. Sure. The majority were edibles.
So your thoughts on home cultivation, 4 plants per household, just your thoughts on that. Do you think that should be allowed?
I think it's going to happen whether you allow it or not. And so again, bringing something into the regulated market is probably better than having it unregulated. In Colorado, for home grows, the real problem that we've run into is extended plant counts and the ability for a caretaker in the medical realm to grow for multiple people, so that you have these very large grows that are, on paper are legal, but are really contributing to black market and diversion.
Mr. Larson, I don't know where BC is going to go with their distribution decisions, whether it's dispensaries or LCBO. I don't even know if they have a liquor control board in BC or not, but you've heard where they're going here in Ontario, and they've already started to shut down some dispensaries and arrest the individuals inside, and it's occurred in your environment as well, and I'm certain. If the BC government determines that you cannot do this, you indicate that you will continue to have customers shop with you anyways. And I just question that. You will not be able to allow, I don't know, do you have a storefront right now? I have no idea about dispensaries, Mr. Larson, because I've never been in one, and perhaps I'll come and visit yours just to learn some more about it. But I just don't know how you will continue to operate if your government in BC decides to have it in a more controlled environment.
Well, that's an interesting point. You know, let's make it clear. They are trying their hardest in Ontario to get rid of dispensaries already. They've been trying for a while, and they are failing miserably. And there are dispensaries in every major city in Canada, and most minor ones now. Just like bong shops. And I told you, bongs are illegal too. And we fought, we got raided. People went to jail over bongs big time in the 1990s. The problem that you have enforcing these laws is that the courts are not willing to give us severe penalties. And we have an overburdened justice system. They laid hundreds of charges, or dozens of charges in Toronto, and they've only kept a handful of them. On the cannabis culture raid, when they went after Mark and Jody Emery and a few others, not a single one of their suppliers was arrested or charged. They're selling cannabis from many companies who have labeling, websites, phone numbers, you can call them. People sell extracts. They could easily, if they wanted to spend the time and effort, go after these people. Then they're not, because the police and our justice system are not able to handle this kind of mass civil disobedience campaign that we're engaging in. We like the phrase overgrowing the government. There's too many of us willing to go to the end on this that you can't keep up. And do you really want to put me in jail for selling cannabis? Is that where you think I belong? Because I'm going to keep doing it, and that's going to be the only option. I'm going to keep giving away seeds. I'm going to keep using cannabis.
Do you charge tax on your products? GST, PST?
Some dispensaries do, some don't. We don't right now, but we're on the transitioning towards that, and I would be happy to do that. And, you know, we're happy to follow reasonable regulations. I'm not an anarchist who doesn't want to follow the rules, but if the rules are saying I can't operate and I can't exist, then of course we're gonna break those rules.
Paying taxes? Do you file?
Oh yeah, we file taxes. All of our staff are registered. We do all the deductions and all those kind of things as best we can. I can't speak for every dispensary. There are hundreds across Canada. Some operate in many different ways than others. But you can't stop us. You don't have the capability in the policing and the courts to deal with what we're doing. That's why it's been so successful, and we're going to keep doing that. So the rules have to take that into consideration, that there is already a vibrant and dynamic cannabis industry, and we are committed to what we're doing, and that needs to be incorporated into legalization, or else you've got to find a way to compete with us and produce better products at a lower price with a higher selection and higher quality. If you do that, we'll go out of business, and I would consider that a victory on my end. If my dispensary can't operate because there's better, cheaper, higher quality cannabis available from a legal source, then I won. I don't need to run a dispensary. I just want cannabis to be legal and available, and so that's how I see it. But until that day comes, as long as my dispensary can provide products that aren't legally available that people want to get, we'll keep doing it.
Well, now I have to stop you. So, Dr. Alfson, it's your turn.
Right, thank you very much. I have the disadvantage of being down the list, so that a lot of the questions I thought of have been asked, so I might have to do basically expanding on some of the stuff we've already talked about. So there may be a bit of repetition. We had some testimony yesterday from some different international experts, and in particular from Great Britain. They're watching us quite closely. And again, we're getting competing testimony from different corners about how to go ahead with this. One of the things pointed out is that, you know, this is a fairly new thing we're doing. Only one nation on earth has ever legalized this on a national level. We're number 2. And we've heard a lot of evidence saying that we should take a cautious, stepwise approach. And we are committed to regulating edibles. We just haven't started with that yet. And we understand that, Colorado had some challenges. So, Mr. Vigil, I understand you had challenges with edibles in the beginning. Could you expand on some of the problems you had with edibles at the initial rollout, and whether you agree it's a good idea for us to be rolling this out more gradually?
Well, really our primary concern initially was seeing an increase in calls to the Poison Center and emergency department visits, and in particular among younger age groups. We had a few cases of overconsumption leading to accidents, and so that was the impetus to try to increase regulation. As to the delay in rolling it out, 288 days, was that it? That doesn't seem like enough time for you to get all of the edible regulations together. I'm not a legislator, so I don't know, but I guess I would recommend erring on the side of giving it more time to not only to work on the legislation, but also for other jurisdictions like Colorado and the other states in the United States that have legalized to continue to learn more. I mentioned that we've seen for 1 year some decrease in those numbers. We'd like to see what happens with the data that's coming up next spring, and the more of that information that you have, I think the better decisions that you can make.
Thank you very much. Dr. Landry, you talked about packaging yesterday. You want to make it non-appealing and child-proof for edibles, which I would agree. Now, we had a discussion yesterday regarding plain packaging and some of the precedents set in the tobacco industry, and particularly the success that Australia has had with decreasing smoking. Despite the misinformation from the tobacco industry about this, it does appear to have cut down smoking rates. So would you recommend, not just in edibles, but in basically all cannabis products, plain packaging, the way that we're going to be moving, the way Australia has and the way we're going to be moving with tobacco?
I think it would be very wise to learn from the lessons of tobacco and alcohol regulation for cannabis, very clearly. So, I mean, recognizing the harms with overconsumption, recognizing the harms with advertising, it's all relevant here, and it seems silly to recreate the wheel for cannabis, but rather to learn and to use alcohol and tobacco regulation as a model for how to best roll out cannabis. And then also to look at what's currently being done in Uruguay or in the states in the U.S. that have already legalized non-medicinal use. So you have models there, you have regulations on the books in those states and in Uruguay. Look at what they've done, talk to them about what their limitations are. If they could go back and change it, what would they do? And then potentially you could come up with a maybe slightly improved model. The key here is that you really need to establish and you have to have confidence in what your unit dose is going to be and how you're going to test and do the quality control. I think if you solve those issues, then the rest of it should kind of fall in place.
Thank you very much.
Mr. Davies, last question.
Mr. Davies.
Mr. Davies, you're up.
Thank you. Mr. Vigil, how long has Colorado been regulating edibles?
Well, excuse me, it was part of our initial legalization passed in 2012, and dispensary sales were allowed to begin in January 1st, 2014.
Okay, and it seems that everything I've heard about the experience of legalization of cannabis, whether it's the Netherlands when they did it, or Colorado, Washington, Alaska, is that you legalize, there is a spike in pretty much everything, and then it levels off, and then things drop. Am I correct in that's sort of what happened in terms of the accidental ingestion? Legalize, I would presume more people tried edibles because they're legal. Some people had experiences with it, more poison control calls, leveled off, and now you're seeing a drop. Is that correct?
We're seeing a slight decline from the peak, but it still remains higher than it was
before.
previous. Right.
Yeah.
And by the way, you say everything, but in terms of use, we have not seen increases in youth or adult use.
We heard evidence from Colorado that there was an increase immediately after legalization, and then it started to drop after that. Am I wrong about that?
Not from our excuse me, our primary data sources, no.
Now, in terms of regulations, you said we should go slow. Could we not just adopt Colorado's regulations on edibles? Like, where are the gaping holes in Colorado that we don't know?
Well, we don't think we've perfected it, you know, and there are limitations within the system. So, for example, our laboratory proficiency testing is. We've had challenges, and a lot of these come from the federal limitations, that there are things, particularly pesticides, that for all other products are regulated at a federal level, and those resources aren't available to us for cannabis. So there are just a variety of places that we would not say that our system is perfect and adoptable.
No, well, nothing's perfect. We're in politics. But, you know, in terms of getting the major things right, the single servings, the child-proof containers, the no marketing to children, the stamped products, the, you know, some form of, like, regulations about potency and dosage, I presume those are done, aren't they, in Colorado?
Yes.
Yeah. So what are we waiting for? Like, what else don't we know about the regulatory framework in Canada that would make it preferable to leave it totally unregulated right now with none of those things while we wait to learn what about the regulations? I'm puzzled.
You could certainly, excuse me, you could certainly make a reasonable argument to regulate and perhaps be more restrictive at first and allow more later. I think the danger is in looser restrictions that then you would later see that you wanted to tighten up. So I would not unwaveringly argue that you have to wait. I would just say that if you can get very solid regulations in place and do it quickly, then
That's my
it
question.
should be fine.
Does
Yes.
Colorado have solid regulations, or they don't have solid regulations?
I think we, excuse me, I think we have solid regulations. I think we have some room for improvement still.
Sure.
But.
Mr. Larson, I think we've heard lots of evidence about the damage criminalization has done to Canadians, and many of the harms associated with cannabis are, I think, directly related to the criminalization of cannabis, not cannabis itself. Now, C45, I think we all would acknowledge, makes progress. But it retains a criminalized approach. You know, it's criminal sanctions for possession over 30 grams, criminal sanctions for growing over 4 plants over 100 centimeters, criminal sanctions over selling, punishable by penalties up to 14 years. If criminalization has failed and caused harm, won't C45 continue to do that, at least to some degree?
Absolutely. It's got more criminalization in this bill than we have already in some areas. And that 14-year penalty also means there's no conditional discharges available as well, which I think is a big concern. And, you know, speaking as a member of the cannabis movement, we don't really need the government's help in getting high-quality cannabis products. We just want the government to stop arresting people. And that really should be the focus of this legislation. It's shameful to me that we haven't decriminalized cannabis possession already, and this wasn't a big priority and hasn't happened yet, but that is the flaw in this legislation, and it's treating cannabis much more severely than alcohol is treated. And yet, by any measure, cannabis is safer than alcohol, and I think that everybody that's testified would agree with that idea. And so if we're going to restrict cannabis more than alcohol, that's driving people towards alcohol. If we're going to restrict cannabis advertising and packaging and all these things more than alcohol is, that means we're saying we want people to drink alcohol instead of using cannabis. And I think it should be the other way around. And the idea that we've made mistakes with alcohol and it's too available, so we're going to tighten up with cannabis, that's absolutely backwards. Cannabis is safer and should be treated like that. And to continue to criminalize people because of the cannabis they have on them or any of this is the wrong way to go entirely.
Thank you.
That completes our normal round of questioning, and so unless there's any inquiry, or did you want to inquire?
Yes, Chair, I'd like to move unanimous consent to have another round because we have about half an hour left.
Okay, do we have unanimous consent for another round? Yes. We have unanimous consent. Okay, Mr. McKinnon.
Thank you, Chair. Mr. Larson, I'd like to find the low-hanging fruit, if you will, about edibles. So, in your shop and in your experience with other shops, what do people want? What are the most popular products? So perhaps your top 3 sellers.
It really depends on what they're looking for, you know? Some people just want to feel good and get high, and some people have a medicinal need, or they've got pain, or they've got cancer or systemic ailment, and they need a different kind of treatment. So it really depends. But edibles are less used recreationally because of the fact they can be stronger, and because of the difficulty of titrating the dose. Most people that I know that use cannabis smoke it primarily. Edibles and extract, and also we use extracts as well, something that I keep trying to bring up that isn't part of this conversation. Things like shatter or hash or other forms of inhalable cannabis that are made, those are also very popular as well. And they allow you to smoke less cannabis to get the same effect. If we're concerned about smoking, you have one hit off one thing, or you got to smoke a whole bunch of something else. Probably the stronger one is the safer one in that regard.
If we're trying to talk about edibles here. I mean,
right. Okay. So with edibles, I mean, so the question is, what do people seek, or why are they taking edibles?
No, what are the most popular?
Most popular edibles are things that taste good. People like treats. They don't want to take capsules or things if they can have something that's yummy. We definitely sell things that are more delicious, more than things that are less tasty. Absolutely. And that's just human nature.
Really come up with a legislation that says, well, let's regulate treats. So we need something a little more specific, if you can.
You can put cannabis into all kinds of food products, right? Some people like to buy infused butter so they can add it to their own food and put it on toast or put it into foods themselves.
Do you sell a lot of infused butter?
Yeah, we sell infused butter, we sell infused oils, and we sell different kinds of edible products. We sell savory things as well, but normally they're kind of snacky type foods.
What are your top 3 sellers of?
Sorry, say that again?
What are your top 3 products, edible products that you sell?
Think about that a little bit. We sell some drops that are very popular. It's not really an edible, but it's a drop that's made with infused hemp seed oil. It's like an edible. I would say that cookies are incredibly popular, and people like different kinds of cookies. And we sell a fair amount of CBD products as well that have very low or no psychoactivity, but have medicinal benefit. And CBD edibles are becoming more and more popular as well.
Okay. Home grow. So one of the concerns with home grow, personal cultivation, I guess, is potential for diversion to the illegal market. Do you see that the regulations around the limitations on number of plants and so forth, firstly, are they necessary to prevent that diversion, and will they in fact prevent that diversion?
Well, it depends what you mean by diversion. It's hard to sell the cannabis you're going to get from 4 1-meter tall plants. You're not going to get that much. But certainly sharing it with your friends, I think that'll happen. And if you really want to stop people from diverting cannabis, make it cheap. The only reason people grow and sell cannabis is because it's very expensive and very profitable. When this plant is worth $5 to $10 a gram, doesn't matter if it's legal or not. If I can grow a plant in my home that's worth $1,000 and then sell it, people are going to do that. The way to stop diversion and to get people to not be doing that is simply to make cannabis much more affordable, make the price lower to where it should be for a natural product. It's the only plant that we sell by the gram and not by the pound. And so I would like to see cannabis be $1 a gram gram or something like that, which is still an incredibly high price for a little bit of plant matter, but that would eliminate the vast majority of diversion if there's no profit in it. But as long as, if legal cannabis maintains the same price structure as illegal cannabis, then the illegal market will continue, because that's just how it's going to be, because of the profitability. And so that's the real question. But I think that most people growing 4 plants at home are going to grow it for themselves or to share with their friends and family, and they're not going to be selling it because the profit margin isn't that great. For a few plants, you're going to want to have a bigger grow to really satisfy the underground market. And I think that's where most of the underground market will remain.
So let's go back to packaging, if I have time. So the edible products that you sell, what's the packaging like? Are these like home cooked products, or are they manufactured in some way?
It's sort of halfway between those things. You know, we strive for a professional product, but it's very difficult to access mainstream bakeries or places to make products if you're going to be making cannabis products. So as a result, we are forced into this kind of area where they're made at home or in a small scale. We use child-proof packaging. We do our best to label our products with an accurate level of the cannabinoids that are in there, although that's a challenge, both simply because of the testing available and because dispensaries can't fully access that kind of testing.
What do you think of?
Okay.
Okay, now we go to Dr. Carey.
Thank you very much, Mr. Chair. I'll be sharing my time with my colleague. But again, Mr. Larson, I'd like to direct the question to you. Again, thanks for being here. And obviously, you're very knowledgeable. And I would think your input and your knowledge about how things are today in Canada on the ground is very important. And I'm curious, as far as yourself or anybody involved in the production distribution field, was anyone you know consulted in reference to the rollout of this as a public policy or the drafting of this bill? Was there any consultation done by the government with anybody that you would know?
No, you mean the task force that was initially put together and that kind of thing? I wasn't, I mean, some people were. I wasn't invited to speak at that task force. Some of my allies or friends will, but I found that just sort of regular cannabis users aren't really in part of this discussion so much. I mean, I use cannabis every day. I used cannabis this morning before I came here, and I'm going to use some afterwards when we're done. And I think that voice is perhaps missing, the typical users. But no, I haven't seen a lot of consultation among the cannabis community in that way.
Thank you. I'd like to move that pursuant to Standing Order 1082, a minimum of 6 meetings be added to the committee's current study of Bill C45, an act respecting cannabis, and to amend the Controlled Drugs and Substances Act, the Criminal Code, and other acts, and that these meetings be scheduled following the appearance of the Minister of Health, Justice, and Public Safety on the week of September 18th.
Dr. Elson.
I move that the debate be now adjourned.
Okay, we have a vote on that now, so on that issue. So, pardon?
The adjourn should be voted on right away.
Yeah. Okay, so we're going to have a vote on that, on Dr. Elson's motion. So all in favor of adjournment on that issue, on that debate? All in favor? Pardon? A recorded vote? Okay, all those in favor of the motion?
In favor of the motion?
Of the motion to end debate?
Adjourn debate.
Adjourn debate. Yeah. So I have to, you have to signal your vote. So are you recording this?
I think it was a recorded vote, so I'm just going to say the name.
It's a recorded vote, yeah.
Monsieur Ayoub?
Mr. Ayoub.
Dr. Yelson?
Yes.
Mr. McKinnon?
Yes.
Mr. Oliver?
Yes.
Ms. Sidhu? Dr. Carey? Ms. Gladue? Mr. Weber? Mr. Davies?
No.
Yeas pour 5, nays contre 4.
All right, motion succeeded, and so we've adjourned the debate on that issue. So we go back to the regular, you have a minute and a half to go.
All right, then I want to talk about child-proof packaging. So will child-proof packaging keep 12 to 17-year-olds from being able to open those packages, Mr. Vigil?
Absolutely not. No.
All right, so it's absolutely no protection at all. So what kind of recommendations would you have? We're trying with this bill to keep cannabis out of the hands of young children. And so the concern is when people bring edibles into the house, that they are attractive. I mean, they're candies or cookies or suckers. They're all the things that kids would want to have. Should they be locking them up, you know, in light of the overdose situations that we saw in Colorado?
Yes, I think they should. As far as regulation, we don't regulate to that degree for products that people bring home. There is regulation that for home grows they have to be locked in a locked area if anyone under 21 is in the home. And really within that age range, it becomes much more important, the education for parents and others who care for children or have children around, that if they're using these products, that they should keep them locked up. And then, you know, of course, education for children about possible dangers of using them.
Very good. How much time do I have?
28 seconds.
All right. Well, then I'll just end with a comment. And Mr. Larson, with all due respect, I find your lack of respect for the rule of law in this country disturbing, because it's clear that it doesn't matter what we come with in C45. You're going to do whatever you like and obey whichever laws you like, and I don't personally approve of that. Thank you.
I believe in the rights.
Okay, that's time's up. Now we go to Mr. Davies.
Thank you. Ms. Larson, I want to thank you for being here. You're the only dispensary owner that we have heard from out of all those witnesses we heard this week. You're the only person involved in the actual edible market who actually is familiar with the products on a day-to-day commercial basis, and I think it's very valuable to have your perspective here. I guess my first question to you, Mr. Larson, is that if we don't legalize edibles, there will be no way to test the THC levels, the CBD levels, all the other different compounds. So products will still be consumed by Canadians, it appears to me, who will have no real assurance of the content, since you, as you said, you can't send these products to accredited Health Canada labs to make sure that the products are what they say they are. Am I missing something there?
No, that's all accurate.
Okay. Now, in terms of, you mentioned the issue of decriminalizing now. Have you faced any legal charges or any people that are patronizing your store? Have they faced any criminal enforcement actions against them? And if not, how has the present criminalized environment affected you and the customers who come into your store?
Well, Vancouver's had a more progressive attitude towards cannabis for quite a while, and so possession arrests are very, very rare in Vancouver compared to other jurisdictions. You'll be hearing from the Hillary Black, who started Vancouver's first dispensary. That was about 20 years ago. We opened ours in 2008. We were the third one in the city. Now there's quite a few. And for us in Vancouver, I've been breaking cannabis laws every day for pretty much all my life, and the first time I've ever been charged was for giving away low THC cannabis seeds in Calgary last year. But it really varies by jurisdiction, and what we enjoy in Vancouver is certainly not the same as the rest of the country. The further north you go in Canada, the rate of possession and trafficking charges increase drastically, and I believe that's largely because our First Nations population also increases drastically the further north you go. So it really varies across the country how these laws are enforced, which is another example of how it's not just. I can do something in Vancouver, which I can get away with, but someone in another part of the country does the same thing, could find themselves in a very serious legal situation.
Now, we heard Mr. Weber commented that he'd never been in a dispensary, and I think he's probably not alone on this committee. I have the benefit of being in Vancouver, where I've had the ability to tour several dispensaries, including the Compassion Club and some licensed facilities. We as parliamentarians are studying this bill, and we have to make recommendations to this bill about all sorts of issues, but we have not toured dispensaries. We have not toured licensed producer facilities, compassion clubs. Do you think that it would be helpful for the parliamentarians in this committee to actually get out in the community and tour some of these facilities, in order to help us evaluate whether this bill is good as it is or whether it could be amended?
I think that would be very worthwhile, and I think to get an understanding of what's really happening and of the limitations of the laws that you're trying to pass and the limitations of the ability to enforce the laws you're trying to pass, I think it'd be very important to see what's actually happening at the grassroots level, and also really to see the people that are benefiting from accessing dispensaries and how it improves their lives and how it benefits our local communities. There's all kinds of dispensaries. I'm not saying everyone is run perfectly by any means, but from what I see, people are glad to have dispensaries. They benefit them, and they provide a lot of positive results. And I think it would be very worthwhile to see what's actually happening at the grassroots level and what people are doing, and understand that the laws that you're passing, the current cannabis laws, are already being ignored pretty much all across the country to varying degrees. If you're not going to take that into consideration when you pass these new laws, they're going to be a failure, because we will continue to ignore these laws, and the courts will back us up on that. And you talk about the rule of law, and you know, some people would say that we have a moral obligation to break unjust laws, and then when laws are punishing people who do not deserve to be punished, when laws are based on racial bigotry and ignorance with how these laws were founded, that we have a moral duty to break those laws. And I personally am glad that I'm able to provide cannabis medicines to those who need it. I believe I am improving people's lives every day, and we will continue to do so.
Some have suggested that once this legislation is enforced and it legalizes simple possession and a few other things, that we as a parliament should take steps to pardon those who have been convicted of crimes that this legislation will no longer render a crime. What's your view on that?
I think we should go further than that. I actually would like, if I was in charge, I would put GST on cannabis, and for the first few years, I'd put that money into a fund to make reparations to those Canadians who have been unjustly imprisoned or had their lives negatively affected by cannabis prohibition. And I really think that the legalization of cannabis should begin with an apology to the cannabis culture and to cannabis users for 100 years of punishment and incarceration and harassment and demonization that was entirely undeserved. Not for me personally, but for the people in Canada who have suffered from this, I would like to see not only a pardon, but an apology and some kind of restitution made, because these laws have been unjust from the beginning, and they remain so today. And we've known this for decades, that these laws do not work, that they're a failure, and it's a real shame that people are still being arrested every single day. A guy spent 3 nights in jail recently for a couple of grams of cannabis in Canada. That should be shocking to the conscience of parliamentarians, that these laws are in place, putting people in prison for jail for 3 days for a couple of grams. And you know, they say the time of the greatest growth of cannabis use in Canada was in the 1960s, at a time when it was a 6-month mandatory sentence for possession and a 7-year mandatory minimum sentence for growing or importing any quantity of cannabis, and that was the time of the highest increase of cannabis use in our country's history. The idea that these laws have an impact on people's behavior, that if you say you can't smoke cannabis anymore, we're all going to stop, that's entirely backwards. Now we're living under mandatory minimums that were passed by Stephen Harper in Canada. That hasn't stopped the proliferation of dispensaries at all. And so I think you need to acknowledge the limitations of what Parliament and the police can do in this kind of a situation, and write laws, craft laws that acknowledge that and take that into consideration.
Time is up, Mr. Davies. Now we go to Mr. Oliver.
Great. Thank you very much. You know, again, one of the advantages of this model that we're using, which I think has been an excellent model for us to hear from many witnesses in a condensed time frame, I think this is the 7th time we've actually been able to do another round of questions, which often in our normal setup we're not allowed to, we don't have time to do. So it's been a good process for us. I had a town hall in my riding of Oakville, and had a good 100+ people turn up. Just people, general public, that turned out to talk about the legislation, talk about pros and cons. And one gentleman really hit home with me. He was really concerned about secondhand smoke from marijuana, worried that if he was exposed to it and he got in a car and drove, would he have, you know, would he show trace elements, worried about different health aspects of it. So I think, Dr. Vandry, you had done a study on secondhand smoke from cannabis on non-smokers. Could you just share with the committee some of your findings from that study?
Ran a research study where we exposed people to secondhand cannabis smoke under different conditions. One was ventilated room environment, one was an unventilated environment, and then within the unventilated environment, we varied the potency of the cannabis that people were smoking. We found a substantial impact of room ventilation on the amount of exposure. In terms of drug testing, whether someone would test positive or not after exposure depended on how you were testing and what cutoffs were used, but we did find that in an unventilated environment, positive tests would be possible for both urine and blood, as well as actually saliva or oral fluid. The duration of time for where you could be positive depended on how you tested and what cutoff you used. But in order to become positive there under those circumstances, it was really limited to that unventilated environment where the room air was dense with smoke. When the air conditioning or the HVAC system was turned on, people were not impaired and were generally tested negative. So I think that secondhand smoke exposure is a real concern. It's a real thing, but it's hard to be impacted by that unknowingly. I think indoor smoking, secondhand smoke regulations are appropriate the same way they are for tobacco use. We've not done the parallel study with vaporization, so we don't really know the level of secondhand exposure with vaped cannabis versus smoked. And then there's obvious limitations beyond that. For the study that we did, we exposed people for 1 hour, one time. That doesn't tell us anything about what happens if they're exposed for a longer period of time or a shorter period of time, but repeatedly. I think, again, this is an area where more science is needed, but I think that our study demonstrated that you can get slight intoxication and test positive in an extreme exposure environment.
Thank you very much. Those are my questions. Thank you. That's my question.
Well, that completes our additional round and our normal round, and on behalf of the committee, I want to thank all the panelists. I mean, you brought great perspective and different perspectives than we've heard, and we appreciate them very much. And with that, I will suspend the meeting until, when's our next meeting? 10:45. Get it right this time. And I want to say that I walked down Spark Street the other night in a cloud of smoke, and I think if somebody had tested me, I would have tested positive by the time I got to the end of the street. But thank you very much, and we'll suspend the meeting. Our standing committee, meeting number 68, standing committee on health, and we're studying C45, an act respecting cannabis, and we're now going to focus our panel on medicinal marijuana. And our witnesses today are from the BC Compassion Club Society, Hilary Black, founder, and Marcel Van de Beek, administrator. From the Canadians for Fair Access to Medical Marijuana are Jonathan Zaiz, Executive Director, and Daphne Elisma, Quebec representative. And from the Department of Health, we have Jacqueline Bogdan, Assistant Deputy Minister, Cannabis Legislation and Regulation Branch, and David Pellman, Executive Director, Office of Medicinal Cannabis. And we're going to ask each organization to have an opening statement of 10 minutes, and you can share it with each other, but the maximum is 10 minutes per organization. And we'll start with the BC Compassion Club Society.
Good morning, and thank you for having me here today. My name is Hilary Black, and I'm the founder of the first medical cannabis dispensary in the country, founded in 1997. In the interest of disclosure, I am also employed by a licensed producer, but I'm here today representing the BC Compassion Club Society, and thank you for having me. Cannabis legalization will affect some of the most vulnerable members of Canadian society, critically and chronically ill patients. We are offering you 7 recommendations in your submission to assist you in prioritizing patient needs. My comments today are focused on 3 main areas: transitioning the BC Compassion Club Society into the legal market, facilitating affordability, and supporting research. The submission additionally addresses the need for a legal range of products and advertising education restrictions. My colleague Marcel Van der Beek will be making some comments about the need to eliminate barriers for small-scale growers. We have been distributing medicinal cannabis openly and safely for over 20 years. We are a nonprofit society with over 11,000 registered patients. We have a subsidized wellness center. Last year alone, we provided 3,400 holistic treatments like massage, counseling, clinical herbalism, and nutritional counseling for little or no cost to our membership. We are a frontlines harm reduction organization. Our clients are often marginalized, have numerous diagnoses, mental health issues, and substance issues. They are falling through the cracks of the healthcare system until we catch them. We have developed the gold standard of education. We know how to maximize benefits and minimize risks and avoid adverse effects. We offer each member a 60 to 90-minute intake session, an intake and education session. This is not possible in a pharmacy. Our community supports us, our neighbors, businesses, local police, healthcare practitioners, and patient organizations. We are a community. We have Christmas parties, picnics, and neighborhood cleanups. The courts have repeatedly commended our work. In 2002, the Senate Committee on Illegal Drugs toured our facility and recommended our model should be replicated across the country. I was nominated by Senator Pierre-Claude Nolan, may he rest in peace, and received a Diamond Jubilee recognizing our significant contribution to Canada. Our model is enshrined into Vancouver city bylaws with incentives to encourage the replication of our services because our practitioners have up to a 3-year wait list. Members of the task force visited us last September. You are all also invited to come and visit us. And when they released their report, Anne McClellan said, "What we learned there, putting aside certain issues of illegality, is that there can be a holistic, wellness-based, street-level approach that serves generally a highly marginalized population, and that this is a model that the report references and suggests the government should take a look at going forward." Despite this extensive recognition from many levels of government, as cannabis is legalized, we are at risk of becoming more criminalized than we were for the past 20 years. We have a massive responsibility to ensure the health care of our members is not interrupted, and we respectfully suggest that you share that responsibility with us. We are a historical medical cannabis institution. We implore you to do everything in your power to protect the roots of this industry. Washington and Colorado prioritize transitioning long-standing medical cannabis dispensaries into the new framework, and we should be following suit. For decades, I have watched patients struggle, choosing between purchasing the medicine that allows them to function and other necessities, like having groceries in their fridge. The problem is the status of cannabis. It's not an approved medicine. Access has been granted through the courts. It is in a category of 1 and not treated like other medications, although many patients access it through physician authorization. This status is problematic for both tax and insurance. Both of these could be solved by creating a fast-tracked regulatory pathway for cannabis to be an approved drug or medicine. For good reason, we do not tax other prescription medications. The courts have stated legislation imposing tax on medical cannabis resulted in confusion and uncertainty and needs work in Hedges versus Canada. Another solution is amending the Excise Tax Act to ensure medical cannabis is zero-rated like other medical necessities and prescription medicines to relieve this unjust financial burden. I'd like to introduce to you Ms. Munia Lababi, who has worked at the House of Commons as a parliamentary assistant to MP Peter Julian for over 12 years. She has been prescribed cannabis for her medical conditions diagnosed while employed by the House of Commons, including Crohn's disease, osteoarthritis, and cervical degenerative disc disease. She exhausted standard medical treatments for these devastating conditions, which proved to be ineffective and have harmful side effects. Cannabis immediately eliminated the need for immunosuppressants, steroids, non-steroidal anti-inflammatories, and other pain medications. It relieves her symptoms, which include nausea, insomnia, debilitating, unrelenting neuropathic and chronic pain. Without cannabis, she can't eat, she can't sleep, she can't function. The costs of her medication are unaffordable, but she cannot go without it. Her family has racked up thousands of dollars in debt in order to afford her prescribed medical cannabis. Even though medical cannabis lacks a drug identification number, Sun Life, responsible for the administration of claims under the Public Service Healthcare Plan, informed Munia that they are set up and ready to cover the costs of this necessary therapy once it is included in her plan. Now I'd like to introduce you to Mandy McKnight. She's employed by the Canada Revenue Agency. Her son Liam is 9 years old and diagnosed with Dravet syndrome, a catastrophic form of epilepsy for which there is currently no cure and the prognosis is unknown. Before trying cannabis, Liam had tried over 10 anti-epileptic medications that failed to control his seizures. He was still suffering up to 80 seizures a day. The side effects from the benzodiazepines and barbiturates were severe, including brain atrophy. Since being prescribed cannabis when he was just 5 years old, Liam is doing remarkably well, and his seizures are more controlled than on any other medication. The cost to the family is over $1,000 a month, plus HST. The alternative therapies, which are less effective and come with terrible side effects, cost between $2,500 and $3,000 a month, but they are covered. Both Mandy and Munia have had health claims for coverage rejected by their employer. Give medical cannabis a drug identification number or something akin to it, perhaps a cannabis identification number, to facilitate fair taxation and insurance. Take care of patients and Canada's public servants. It's the right thing to do. You could lead this government, the country, and the world by including cannabis in the Federal Public Health Services Care Plan. Treat patients with the dignity, compassion, and support that they deserve. We have an opportunity to be world leaders, expanding the evidence base of benefits and the safety profile of medical cannabis. We are facing an opiate and overdose crisis, and cannabis has tremendous potential as a harm reduction tool. We urge you to invest significant resources in human clinical research in cannabis and cannabinoids, prioritizing researching the potential of cannabis in managing pain and as a harm reduction tool for addiction and substance abuse. The Compassion Club has required tremendous experience with people struggling with problematic substance use and using cannabis as a harm reduction tool. We have witnessed the potential of high-potency edibles and resins being substituted for recreational and medical opiates, methadone, alcohol, and cocaine. This country needs solutions to the opiate epidemic, and cannabis has incredible potential. We implore this committee to do everything in its power to transition the community-based, long-standing, frontline harm reduction organization, the Compassion Club, and other long-standing medical cannabis dispensaries that pioneered the medical cannabis movement and industry into the new regulatory framework. Please consider the 7 recommendations in this submission to improve the care of patients. Thank you, and I'd like to introduce you to my colleague Marcel Van de Beek, who will be making some brief comments.
Good morning. My name is Marcel Van de Beek. My roles during the 19 years at the BC Compassion Club Society have included frontline dispensing of medicinal cannabis for 5 years, administrative for 15 years, and purchasing for 17 years. I've been working with the suppliers of the BC Compassion Club to ensure consistent supply of high-quality medicinal cannabis to our membership. As my colleague Hillary said, we are a registered not-for-profit society focused on providing holistic health care for those who most need it. We work with small-scale growers who cultivate specifically for our members at below-market pricing. They have cultivated specialty strains and have amassed a tremendous amount of expertise, including organic cultivation methods. None are related to organized crime, and all have taken on great personal risk to help us meet the needs of our members. We ensure the ideological values of the suppliers we work with, and we reject the producers who are solely profit motivated. We have a strict cap on pricing which weeds out those who are not aligned with our mission, vision, and values, including asking them for smalls and donations. For example, we have a cultivator named Joe who lived with a serious disability, grew organic cannabis for us. He used to donate thousands of dollars worth of cannabis every Christmas to help us gift it to our members in order to help alleviate their financial hardship during the holiday season. He used the small profits to fund a summer camp for disabled children. Sadly, he was raided by the RCMP. He was never charged, but as a result, he was forced to end his summer camp. These are the good, honest, hard-working, law-abiding Canadians this government is looking at as the criminals who must have the industry taken out of their hands. In fact, they're the people you should be bringing out of the shadows and into the light. The current process for applying to be a licensed producer is inaccessible financially to small-scale producers and to small business people, which is part of what is needed to fill the supply shortages and illicit production. The pioneers of the medical cannabis movement and industry will not be included in the legal market unless you dissolve the onerous barriers to becoming licensed. Thank you for the opportunity to speak to your committee today, and we look forward to your questions.
And thank you for your comments. Now we're going to move to the Canadians for Fair Access to Medical Marijuana. Mr. Zaid, 10 minutes.
Thank you, Mr. Chairman, and to the Standing Committee for your invitation to appear here today. We will be speaking on behalf of two organizations, Canadians for Fair Access to Medical Marijuana, also known as CFAM, and the Arthritis Society. I am the founder and executive director of CFAM, a national nonprofit organization focused on the needs of medical cannabis patients. The Arthritis Society, Canada's principal health charity providing education, programs, and support to the over 4.6 million Canadians living with arthritis. Over the past 2 years, the organizations have collaborated extensively on important issues surrounding medical cannabis research, access, and affordability. The brief submitted to the committee is a joint submission between the two groups, and any follow-up can be done with myself or Janet Yale, CEO of the Arthritis Society. You may recall Janet recently appeared before this committee on other issues, including national pharmacare. I'd also like to introduce Daphne Elisma, CFAM's Quebec representative and a member of our Patient Advisory Board. She'll present in French momentarily. First, I'd like to share a bit about my personal story. So much of what we hear about cannabis is focused on the harms and risks, which of course are important issues, but my experience and the experience of many other patients is quite the opposite. On April 22, 2007, at the age of 14, I woke up with a constant headache that still remains today 24/7. This neurological condition, known as new daily persistent headache, is said to be one of the hardest pain conditions to treat. After trying over 40 prescription medications and all other therapies, I was near ready to give up. I had no quality of life. I could not leave the house due to noise, sensitivity, and low energy. I dropped out of grade 8 and struggled throughout high school. I finally turned to medical cannabis. It helped reduce painful flare-ups and allowed me to sleep. Although not a cure, the effective symptom management enabled me to concentrate and be successful in my academic studies. I advocated for insurance coverage and was the first in Canada to get successful insurance coverage for medical cannabis in this manner. Medical cannabis patients are often looked at as stereotypical stoners. Yet to myself, Daphne, and the patients we represent, effective symptom management translates to increased quality of life and functionality. Cannabis is a medicine. There are over 200,000 authorizations for the use of cannabis as a therapy to manage a variety of health conditions, including seizures, pain, insomnia, nausea and vomiting, and side effects from prescription medications. Although there is legal access to medical cannabis, there are still many challenges associated with its use. We need more research. Access to various product forms and retail distribution are important issues. And one of the most pressing concerns facing patients remains to be affordability. As the government progresses with legalization, one of the primary goals is to reduce consumption. Although laudable for recreational purposes, the government's goal ought not to be to restrict access to medical cannabis, a medicine, but rather to ensure a safe, reliable, and affordable supply for those who medically require it. There are 3 issues that we will be highlighting today: the importance of a distinct regulatory framework, research, and affordability, which Daphne will speak to. Although we need more research, a recent review by the U.S. National Academies found substantial evidence for the use of cannabinoids in conditions including chronic pain, MS, and chemotherapy-induced nausea. The two most studied cannabinoids are THC and CBD. THC, the cannabinoid that causes the stereotypical high associated with cannabis, has medical properties including analgesia. CBD, a non-impairing cannabinoid which has been shown to have anti-inflammatory and anticonvulsant effects, also limits the impairment and side effects caused by THC. Many patients use these two cannabinoids in combination to gain the most effective symptom management while limiting potential of impairment. Again, for most people using cannabis for medical purposes, this is not about getting high, but rather effective symptom management and increased quality of life. Cannabis is a legitimate medication, and it must be treated that way. And it's important that it be treated that way in a distinct regulatory framework. In crafting Bill C45, we want to commend the government for recognizing the need to maintain a separate and distinct regulatory approach for medical cannabis, and we want to make sure that this is maintained. Beyond the government's constitutional requirements to provide reasonable access to cannabis for medical purposes, we believe cannabis and patients' needs are best suited to be addressed in a distinct regulatory framework. And moving forward, beyond Bill C45, it is important that the government prioritizes and adequately supports the needs of patients by addressing their unmet needs. And of course, research is a very important issue. There is an enormous deficit of properly funded research in Canadian clinical trials into the therapeutic use of medical cannabis. This creates barriers to patient access as many physicians express reluctance to authorize medical cannabis in the absence of robust peer-reviewed research. The lack of scientific and clinical research has also been cited by Health Canada as a key reason why medical cannabis is not yet regulated as a therapeutic product, which affects the ability of patients to access medical cannabis through private or public drug plans. In particular, more research is needed in terms of dose, indication, and form. To that end, we have asked, as part of Budget 18, for the federal government to commit $25 million over 5 years to support medical cannabis research. This investment will go a long way towards expanding the evidence base for medical cannabis, and it's a small amount compared to the $274 million already proposed for enforcement. And although we fully support enforcement and research into the risks associated with recreational cannabis use, we believe it's necessary for the federal government to invest research specific to the medical use of cannabis. This is an urgent and vital step towards further understanding and recognizing the legitimate medical use of cannabis and ensuring the sustainability of a distinct regulatory framework. And in terms of improving access, we believe in addition to the continuation of mail order and personal production, pharmacies should have exclusive authority to retail medical cannabis and further product forms should be made available. Sales through pharmacies would go towards improving affordability, including the elimination of sales tax based on the Excise Tax Act and increasing the potential of insurance coverage. Pharmacists will help enable that patients across the country are able to receive reliable education on the safe and effective use from trained healthcare professionals with regulatory oversight. While retail and distribution decisions are largely provincial competencies, in order for pharmacy distribution to happen, the access to cannabis for medical purposes regulations will need to be amended. I will now pass it to Daphne to discuss affordability.
Après plus d'une décennie au sein de Santé Canada et en
After over a decade at Health Canada and in my capacity as a legal expert, I advocate for patients who use medicinal marijuana. In fact, I myself use CBD successfully to treat complex regional pain syndrome following a breast cancer treatment. The issue of affordability represents a major one for patients, the patients that we represent today, because medicinal marijuana is the most effective medication to treat their condition. We feel that that medical marijuana should be exempt from tax. When a patient procures a prescription medication for medical needs, the medication is exempt under federal legislation. Because medicinal marijuana meets these criteria, the government should make it free of sales tax as well, making it more affordable. We are asking for the adoption of policies and programs that facilitate the reimbursement of medicinal marijuana under public and private plans. We recommend that the government approve cannabis as a therapeutical product, assigning it a medication identification number and facilitating its reimbursement. In summary, patients who use cannabis to alleviate their physical and psychological conditions feel discriminated against. The government is drawing a distinction between these patients and those who use conventional medications such as opioids to treat the same condition. Patients often feel obliged to use an opiate instead of cannabis because of its lack of affordability. Taxation and a lack of reimbursement of medical marijuana represent an excessive constraint for patients. The improvement of the rights of patients who use medicinal marijuana must remain at the heart of these discussions. I thank the committee members for this opportunity to address myself to you today.
And now we go to Ms. Bogdan. Welcome back.
Thank you, Mr. Chair. Thank you for the opportunity to appear before the committee again this morning. I will ask the committee's understanding. My voice, I got a bit of a cold in the last few days, so my voice is not as good as on Monday, but we'll do the best that we can. As public servants, my colleague and I, Mr. David Pellman, who's responsible for the Office of Medical Cannabis, as public servants, we're responsible for administering on behalf of Health Canada, the current regulatory framework that enables Canadians to have access to cannabis for medical purposes. Mr. Chair, I'd like to provide the committee with an overview of the regulatory framework focusing on 4 areas. One is how the current framework is designed, how it works, and the number of Canadians who presently benefit from it. 2, I will outline the robust requirements and controls that apply to licensed production of cannabis and that are designed to protect public health and safety. 3, I will describe some of the key improvements that Health Canada has made to the program over the last 6 months. And finally, I'll outline why and how this framework would be preserved under the proposed Cannabis Act that is before you. Mr. Chair, Canada has had a system of access to cannabis for medical purposes in some form since the late 1990s. The regulatory regime was put in place following a court decision that determined that the Government of Canada must provide some lawful means for Canadians to have access and possess cannabis for medical purposes. The framework has evolved considerably over time as the government has introduced improvements and has responded to a number of court challenges and decisions. Most recently, in April 2016, the federal court determined that the regulatory framework that was in place did not provide individuals with reasonable access to cannabis for medical purposes. In this instance, reasonable access was defined as having access to available and affordable cannabis. In response to this decision, Health Canada introduced a new regulatory framework, which is called the Access to Cannabis for Medical Purposes Regulations, a little over a year ago. Under this new regime, Canadians who have the authorization of their healthcare practitioner can access cannabis in one of 3 ways: by purchasing quality-controlled cannabis from a federally licensed producer. Individuals register directly with the licensed producer, and the product is delivered securely to their home, either through the mail or by courier. Individuals also have the option to register with Health Canada to produce a limited amount of cannabis at home, or to designate someone to produce it for them. As I mentioned, Canadians must have the authorization of their healthcare practitioner in order to access cannabis for medical purposes. Health Canada believes that the decision to use cannabis for medical purposes is one that is best made by a healthcare practitioner and his or her patient. Health Canada provides information designed specifically for healthcare practitioners on its website. The department also works closely with provincial and territorial regulatory authorities, which in turn provide guidance to the healthcare practitioners in their jurisdiction. Healthcare practitioners are authorizing cannabis as a treatment for a wide range of symptoms associated with medical conditions, including nausea in patients undergoing chemotherapy, loss of appetite and weight loss associated with HIV/AIDS, and pain and spasticity associated with multiple sclerosis and arthritis. At this time, under the new regulations, there are more than 210,000 active authorizations for the use of cannabis for medical purposes. Of this number, 200,000 active registrations are with the federally licensed producers, and individuals purchase their product directly from them. 10,000 individuals are registered with Health Canada to produce a limited amount of cannabis at home, or to designate someone to do it for them. The number of client registrations with licensed producers is continuing to grow at a rate of approximately 9% a month since licensed production began in 2013. The number of healthcare practitioners that are authorizing the use of cannabis has also grown steadily. There are now 10,000 healthcare practitioners authorizing use, which has doubled since June 2015. Mr. Chair, I would now like to describe briefly the system of regulated production of cannabis in Canada. There are currently 58 producers that are licensed to produce cannabis for medical purposes. These producers are the only legal commercial source for regulated, quality-controlled cannabis for medical purposes in Canada. The regulatory framework sets out a series of strict requirements that must be met to protect the health and safety of Canadians and the integrity of the legal system. For example, licensed producers are required to use good production practices in their facilities, such as a sanitary program and having a dedicated person responsible for quality assurance. They must test each and every lot for mold, bacteria, and other potential contaminants before those products can be released for sale to the public. Licensed producers must also test each lot for THC and CBD potency, and those results must be displayed on the label. In terms of preventing diversion to the illegal market and ensuring the integrity of the legal system, all license holders, directors of corporation, and all senior personnel in the facility must have a security clearance. This security and clearance involves a criminal record check as well as a law enforcement record check to identify any known associations or affiliations with organized crime. In addition, all facilities must have physical security and inventory control measures to prevent theft or diversion. These standards and controls are backed by rigorous compliance and enforcement. Last year, Health Canada inspected each facility an average of 7 to 8 times, conducting roughly 275 inspections. These inspections verify that good production practices are being met, the test results for all products that are produced, that only authorized pesticides are being used, and they review inventory records and the security control measures that are in place in these facilities. I will also note that Canada's system of regulated production of cannabis is recognized internationally. We receive frequent visits and calls from other countries for advice on our patient-focused approach, strict licensing regime, and our compliance and enforcement program. Mr. Chair, I will now outline some recent improvements to help ensure that Canadians continue to have reasonable access to cannabis and can have confidence in the quality-controlled supply of cannabis for medical purposes. In May this year, Health Canada announced that it will require all licensed producers to conduct mandatory testing of all cannabis products for the presence of unauthorized pesticides. In addition, Health Canada is conducting unannounced inspections of all licensed producers and randomly testing lots and products for unauthorized pesticides. Also, in May this year, Health Canada added additional resources and introduced a number of improvements to streamline the licensing of producers and enable increased production of cannabis while maintaining quality control and oversight. These measures will also help ensure that a legal, quality-controlled supply of cannabis would be available should the proposed Cannabis Act be approved by Parliament. Mr. Chair, the question of whether to retain a separate framework for access to cannabis for medical purposes was a key question that the government asked the task force of experts on cannabis legalization and regulation to consider. The task force consulted broadly, as you know, and extensively with experts in public health, law enforcement, patients and advocates, including the others who have joined me at the table today, as well as licensed producers. During these consultations, the task force heard how cannabis is making a difference to Canadians living with serious health challenges, such as cancer, HIV/AIDS, multiple sclerosis, arthritis, and fibromyalgia. They also heard about the role that cannabis can play in pain management and palliative care and the relief that cannabis offers to children with severe forms of epilepsy. Based on their findings, the task force recommended that the government maintain a separate medical access framework to support patients. It also recommended that the government monitor and evaluate patients' reasonable access during the implementation of this new legislation and evaluate within 5 years. The government has accepted the advice of the task force, and the proposed Cannabis Act that is before you will enable the framework to continue. In closing, Mr. Chair, I wish to emphasize that Health Canada is committed to enabling Canadians to have reasonable access to cannabis for medical purposes. We will continue to monitor closely, as we do today, and be prepared to take additional measures if necessary. Finally, we will continue to seek the feedback of patients and producers to continuously improve how we administer and ensure that Canadians are well served by the program. And we would be happy to answer your questions. Thank you.
Thank you very much. All right, now we'll go to our first round of 7-minute questions, and we'll start with Mr. McKinnon.
Thank you, Chair. My first question is for Ms. Bogdan. Mr. Zaid has, in his presentation, has asked for a drug identification number to be assigned to cannabis. I was wondering how that would work, whether there are issues with that, and what would be involved.
Thank you for that question. Cannabis can be classified as a therapeutic drug under the Food and Drugs Act. If a company wishes to market a drug in Canada, there is a process that they can go through to apply to do so. And Health Canada would review the evidence that is put forward to verify the product's safety, efficacy, and quality. Part of the process involves presenting results of preclinical and clinical studies that have been conducted either in Canada or overseas, and details regarding the production and the packaging of the drug and a number of other aspects. So at this time, cannabis itself, either in its dried, fresh, or oil form, has not been authorized as a therapeutic product. No company has brought forward an application or the clinical evidence that would be required. However, I would point out that a number of cannabis-based drugs, there are in fact 2, have been approved, have undergone the market authorization process, have received a DIN, and as such are available for sale and would be eligible for reimbursement from plans.
Okay, so apart from those 2 products, I mean, a producer or manufacturer hasn't come forward and said, listen, we want a DIN for this product, and here is the evidence, and so on and so forth. Okay. Mr. Zaid, can you give us any feedback regarding that? Have you talked to people about applying for such an identification number?
Yeah, so we'd absolutely love to see a drug identification number application put forward by a drug company, but one of the issues surrounding cannabis and what makes it unique is that it's a plant. It's not a patentable molecule, and that's typically what the Therapeutic Drug Directorate regulates. So when talking about cannabis, there's a wide range of indications. So really, it does come back to the research. We really need to focus on medical cannabis-specific research. And the government has an obligation, we believe, in this role, because of the limited patentability of cannabis, to really incentivize research and ensure that we have the research needed to get to that DIN. But really, in the interim, we do believe cannabis should be assigned a DIN or something equivalent to start facilitating reimbursement, as it's such a vital issue for patients across the country.
It sounds like there's not enough research, and it just needs people to enter the formal process to make that happen. And you're not aware of anybody having started such a process?
In terms of the application process, but there are definitely some small-scale clinical trials ongoing by some of the licensed producers, but it's not nearly to the degree that we would like to see it. We'd also like to see the $25 million invested to CIHR so that they can grant it out so that it's unbiased research, not necessarily sponsored by drug companies as well. So really it does come back to the research and again, the patentability, as well as really the wide range of indications means that there's a lot of research to be done, expensive clinical research. The Arthritis Society, about a couple years ago, held a forum, brought all the researchers together, and created a report that set out a list of priorities. So now we have the priorities, we know what we need to study, we really just need the funding to enable us to do that.
I think Ms. Black would like to respond to this. Is that correct?
Well, I mean, part of the, there is quite a lot of great research around medical cannabis. It's large-scale human clinical trials that is really where the dearth of research is. And we have to remember that we're talking about a plant that's been prohibited for almost 100 years. So people that have been wanting to research it, it's been impossible to find a legal, consistent supply. It's very onerous and takes an extremely long time to get licensing, even for laboratories. So one of the things that this government can do besides funding research is to encourage, facilitate, and expedite it in any way that's in your power to do so.
I mean, you say there's a lot of research out there, though, but unless someone starts a process for an application, it's not going to do anything to achieve a drug identification number.
I mean, as Jonathan said, there is some complications around cannabis because it isn't patentable. But, you know, my understanding would be that if the government allocated some resources and from your side encouraged research into the medical applications of cannabis rather than holding it back, that we would be able to start seeing more progress.
I see.
Comment there, did you?
If I could offer, one, I perhaps should have said that in my first answer to the committee member's question, Mr. Chair, is that, the proposed Cannabis Act would provide greater flexibility for the minister to authorize different types of cannabis research than we do now. And what I mean by that is, it would improve the current process, which requires individuals to seek an exemption in order to be able to do this kind of research. So I think, one of the virtues of the proposed legislation is that it will enable and facilitate research. And I perhaps should have mentioned that from the outset.
Ms. Black, I believe you're asking for prescriptions to be issued instead of authorizations, and you feel that it would be better, give better access to the product. Is that correct?
Well, because the current medical regulations, the ACMPR, we call the authorization to cannabis an authorization rather than calling it a prescription, because this is like the chicken and the egg, back to the fact that it's not an approved medicine, and so you can't technically call it a prescription because it isn't actually an approved medicine. But by calling it an authorization and not a prescription, that is the answer that many people come to on the dead end of trying to either get insurance coverage, and the reason why the tax courts said that GST is applicable to medical cannabis.
My understanding, though, is that doctors are reluctant to issue prescriptions because they don't have the research to back them up. They don't know the specific medical consequences of particular potencies and so forth, so that I suspect they would be less likely to issue a prescription than they would issue an authorization.
I mean, I am not a physician, but I do communicate with many physicians regularly, and I would suggest that the authorization form that physicians currently have to fill out actually takes more time and is more onerous than filling out a prescription on a prescription pad. So I think whether we call it a prescription or an authorization, it's not going to address the issue of the research and education that is needed for physicians across the country.
Thanks very much. We'll go to Mr. Weber.
Mr. Chair, and thank you to the panel for being here today. And I also want to thank Ms. Black and Mr. Vanderbeek for the work that you do and you have done for the last 20 years. I am a strong advocate for medical marijuana. My wife, at 37 years old, diagnosed stage 4 breast cancer, going through incredible chemotherapy and radiation, and the nausea was intense. It was uncontrollable, to the point where there was desperation. We had to go to the illicit market to get marijuana, to try it, and it worked. It worked for her nausea. Of course, back then, we had no idea what was in it. Obviously, there was strong THC in it, which caused a lot of bad experiences, but it took away her nausea. So to be able to come to an outlet where they can prescribe at the proper marijuana for patients who suffer like that, I think is vital to Canadians. And so I, again, am a strong advocate there. One question I have is, you talked about some of your young patients, and of course, Mr. Zaid being a young individual as well, requiring marijuana. I'm happy that you found something that helps your headaches, by the way. And I ask you both, are you not concerned about the strong scientific evidence of the correlation between use as a youth and mental issues because of your developing brain? Maybe I'll start with Mr. Zaid.
First of all, yeah, of course I'm concerned about that. I mean, but I think it's a different context when we're speaking about medical use from other recreational use. I tried 40 prescription medications. Not one of those medications was ever studied in my condition. None, no research whatsoever. They had side effects that included death, included cognitive impairment, right? And these were given to me without any of these types of questions. So I think it comes back to when you're suffering a medical condition, there's risks to alternative treatments. There's risks to not having effective treatments. So for me, the risks really weren't comparable to the benefits that it could afford me. And I think that's the issue with lots of patients. And the second aspect I would propose is also, we talk a lot about cannabis as a whole, but really there's hundreds of chemicals within the plant itself. THC does have some research that, is concerning regarding adolescents' brain development, but lots of the pediatric patients are on pure CBD, and that research isn't correlated to the brain development. So with those two aspects, the medical context as well as different cannabinoids that may be being used, I think, there is definitely potential among young people.
Is it the CBD that helps you in your headaches? Or
Yeah,
is it a mixture of both, or is it the THC? What has helped you?
Yeah, so it's a mixture. During the day, I usually use mainly CBD. I'm on cannabis right now. I don't think anyone would think I'm impaired. Most people wouldn't think I have a very severe chronic illness either, right? I have effective symptom management. I'm not high. I use a bit of THC at night. It helps me sleep, and that's such an important thing to having a healthy lifestyle. So overall, it's really effective to improving my quality of life.
Ms. Elisma, you mentioned that you're a cancer survivor, and you continue to use CBD. You mentioned in your presentation. I understand that marijuana is good for nausea and such, but why would you continue to take it after your treatments?
Une chose que j'ai pas mentionnée dans mon introduction tout à l'heure, c'est que
One thing that I didn't mention in my introduction earlier was that in addition to my medication for chronic pain, I also developed migraines, which are very persistent. So CBD, well, my treatment is CBD, but there's also THC, which improves my quality of life. And currently, I have no problem with migraines. They've completely disappeared since I started this treatment. Before, I was using a number of different prescription medications, like naproxen, very powerful medications that created difficulties, health problems. And so when I turned to medicinal marijuana, it really greatly helped me have a better quality of life. So it's a treatment that I wish to continue.
Bogdan, you described licensed producers and the strict requirements that they have to adhere to, and I had the opportunity to tour a licensed facility north of Calgary, which you described it accurately. It was like entering a federal prison to get in there to begin with. But yes, sanitary requirements. You can eat off the floor. It was that clean and very, very impressive anyways. And I encourage all our members to, if you have the opportunity to tour one of these licensed producers. With respect to a comment you made about strict clearance for licensed producers, we've had a number of presentations here where people have recommended that we allow individuals who have had past experience, perhaps even convicted marijuana convictions, to allow them to apply for licenses and be accepted for that. Can I ask what your thoughts are on that?
I think the government puts in place we have a process around the security clearances that is in place principally for two reasons, right? One is to protect the integrity of the system, of the legal system as it stands now. And also to protect it against diversion. So very consciously have made decisions around the requirements for security clearances for all of the key individuals in the organizations. And it's an important feature of the system and would continue to be going forward if we want to ensure that the system isn't infiltrated by organized crime. So while we are certainly aware of the positions that others have put forward, and those will be taken into consideration as the regulations are designed in the future, I think we also need to remember the objectives that the government has in protecting the integrity of the system.
Okay. Go to Mr. Davies.
Chair, thank you to all the witnesses for being here. Mr. Zaid, in what form do you ingest your cannabis?
I mainly ingest via vaporization as well as some capsules. I find personally it's the most effective for me, but I definitely would like to try other product forms, including sublingual tinctures and creams for nerve pain. These products aren't available within the system, and there was a Supreme Court case that ruled that patients should have access to a diverse range of products. Health Canada responded to that by allowing the sale of oils and capsules, but there's limited potency in the capsules, which is a big problem, and there's still not basic products like creams available. So we would like to see a wider range of products.
Madame Elisma, how do you ingest your cannabis? Do you smoke it or do you take it in some other form?
Like Mr. Zaid, I use a vaporizer, and I also take it in oil form, which I purchase from legally, and it helps me manage my pain symptoms. So I also use the dried form sometimes. Sometimes I smoke it, depending on my daily needs. But mainly, I vape it, and I use it in oil form. Thank you.
You testified about the licensed producers. There's you call it a strict licensing regime. You test for pesticides and mold. You test for CBD, THC levels. You test for sanitation and safety. There's inspections. None of that is being done for edible manufacturers today, is it?
Well, what licensed producers under the current system are allowed to produce is dried cannabis and cannabis oil,
right,
which can come in many forms.
No, I understand that. So
right.
Edibles are not part of that regime. None of that testing regime you described applies to anybody making edibles in this country right now. Am I correct in that?
You mean an individual who is allowed to produce a limited amount of cannabis at home?
Anybody who's making edibles products for sale in this country, illegally or otherwise, are not subjected to that testing regime, is what I'm trying to establish.
Well, no.
Right. Now, Ms. Black, one of your recommendations is, I quote, ensure legal access to cannabis products in all of its various forms and potencies, including but not limited to herbal cannabis, capsules, tinctures, topicals, resins, and finished edible products. Otherwise, patients will continue to access them in the unregulated market. This move would bring federal policy in line with the recent Supreme Court ruling R. and Smith 2015. Can you elaborate on that and maybe explain the reference to the Smith case?
Certainly. You heard from Kirk Tusaw yesterday evening. I wish that he was here today to speak in more detail about that case. My understanding is that the spirit of that ruling essentially ensured that there's charter protection for patients to use cannabis in all of its forms. And we see that at our organization, that we have a very broad range of forms that cannabis can be used in, many of which have been named here. And I think that if all of those products are not included in the legal market moving forward, if these regulations don't follow the spirit of that Supreme Court ruling, even though it's about patients, but applying it to the recreational market, that again, we're just going to have all of those products being produced in an unregulated environment. One of my greatest concerns is that some cannabis concentrates for inhalation are made with carcinogenic solvents currently. Like butane is actually a solvent that people use used to make inhalable extracts. And if it's not produced correctly, it can have carcinogenic remains left in the product. So in fact, potent inhaled products are one of the most important things for the government to regulate.
Now, in terms of the BC Compassion Club Society, what percentage of products are your patients and customers purchasing that are not, that fall into the edible, concentrate, and non-smokable form?
I would say probably roughly about 30%. However, on the edibles, since the City of Vancouver had demanded essentially that everybody stop having edibles for sale, we stopped carrying them. We wanted to obviously stay compliant with the city bylaws. So let's say in the last couple of years that number's been a little hard to figure out, but yeah, I'd say roughly 30-35%.
And we've heard some testimony on labeling products. I'm wondering what advice you'd give this committee on what kind of information should be on a package to help a consumer, I guess, make an informed choice of the cannabis product they may choose.
I have some concerns about plain packaging requirements. One being that, again, it will give an advantage to unregulated producers to be able to, create colorful or attractive packaging. Anything that you restrict in the legal market that the unregulated market can do, you're going to create an advantage. In our experience, it's very important to be able to have some product information. And also, I think that there is some sort of branding that's necessary for consumers to be able to distinguish about who the producer is, what the company is that they're buying cannabis from. So I think that this is a place where this committee will need to really find a balance between labeling restrictions and also being reasonable about it. Again, if we look at the way that we're able to package alcohol, which we know is more harmful than cannabis, that you're able to have product information and some branding, some fonts, some colors on the packaging. I think that if we want to restrict things like cartoons or things that would really specifically, draw the attention of children, I think that's reasonable.
Thank you. And dispensaries versus pharmacies. Do you have any opinion on the?
Well, this is a very complex issue. The pharmacies have, the governing bodies of the pharmacies for a long time have said that they are very opposed to medical cannabis, and it's not until quite recently that they have come along realizing that there's quite a large and profitable business to be had being a distributor of medical cannabis. So I do believe that cannabis should be in pharmacies. I think that that's one way to give equal access to patients across the country, but I absolutely do not think it should be exclusively in pharmacies. Last year, I had the privilege of organizing a special meeting of patients for the Task Force on Legalization with CFAM and the Arthritis Society. And we had a wonderful half-day meeting with a diverse group of patients. And there was only a few of them who wanted to only access cannabis within a pharmacy. Mandy McKnight, who is here, will talk to you about the problems that she has when she goes to get her pharmaceuticals for Liam in a pharmacy, and how what she really wants is something like what the Compassion Club has, which is a specialized medical cannabis storefront where people can come. We will spend 60 to 90 minutes educating them. We will spend the time talking about all of the different possible products and how to take them very safely. And we have the experience and the expertise and the care to take care of medical cannabis patients in a way that I think is superior to what any pharmacy can provide.
Thank you.
Okay, thanks very much, Mr. Davies. Now we go to Mr. Ayoub.
Yes, thank you, Mr. Chair. I'm going to ask the question in French, so if you need the here, please do so. Je voudrais commencer par Monsieur Van de Beek.
I would like to start with Mr. Van der Beek. You mentioned earlier that while you don't do production, but you sell cannabis. And how do you ensure that you have a price below the market? What is the price of cannabis currently per gram?
Roughly about $4.84 a gram. Normally we purchase by the pound, so
okay.
It's prorated.
Okay. Donc, merci pour le...
Thank you for that answer. I've heard a lot between $10 a gram and more at different levels, but this is an important point to ensure that we remove the black market, the illegal market in organized crime. You mentioned that you have providers who are clear, who are not members of organized crime, and that's good that you have moved in this sense. That's what I've understood.
Madame Bogdan, question pour vous.
Ms. Bogdan, a question for you. Among the producers who are authorized, you said there are 58 of them. You said you have 275 inspections that you carry out. Have you made any observations of infiltration or breaches by organized crime? Are there any producers who have had their licenses withdrawn or amended following the issue of infiltration of organized crime?
Mr. Chair, for the question, no. The answer is no. And I think part of that is in the design of the system, the very strict controls that we have up front in relation to security and who can be involved in the industry.
J'ai une autre question suite à votre réponse.
I have another question to follow up on your answer. If I'm not mistaken, Mr. Rick Barnum, the commissioner of the organized crime in the division at the OPP, mentioned earlier that it's certain that organized crime has infiltrated cannabis producers, licensed cannabis producers. He seemed to be very adamant in his testimony earlier this week. What is your response to that?
Categorically say with respect to the licensed producers that would be untrue to our knowledge, and that if anyone had evidence to the contrary, I think it would be very important to bring that to the attention of the RCMP and others, and ultimately ourselves, if there was a concern of that kind.
Okay. Donc, il y a lieu.
So perhaps he should have done more in-depth research on the issue. I think it's concerning, potentially. Another thing, and without asking questions, if I correctly understood what Ms. Elisma, Mr. Zaid, and Mr. Black they are seeking a bin number. No requests were made by anyone, no industry, no producer. Is cannabis in a class of its own? It is a vegetable. It is a plant product. It's medicinal to a certain point. We need more research to provide more administrative proof, and some scientific evidence has been shown. What is preventing us, and what would be your recommendations? What is preventing us from amending the regulations to have a tailor-made process for cannabis? What would be your recommendations to the minister to make a change to the process to allow doctors to prescribe this and to not have a long authorization form to fill out? Do we need something shorter? What do you recommend?
That's a question that actually the task force itself, the task force on cannabis legalization, considered in its deliberations on the medical access system, given the input and feedback that it received from patients and advocates about whether there couldn't be a separate pathway considered in order to be able to authorize these drugs, or a different way to do it. I think that after careful consideration and deliberation, that the task force came to the conclusion that the system that exists now can work, that the government should do what it can to encourage research, including by making the changes that it is making through this legislation that would encourage research at the clinical, preclinical, or clinical level at universities, or research that might be funded by licensed producers. That the system that we have works, and that by encouraging research, we will probably see increased research in those areas that would lead to market authorization for cannabis in its dried or other forms.
On est encore jusqu'à maintenant.
Up till now, we're seeing that this is this has been a failure, or there's a problem because no producers have made this request, because I'm assuming that there were likely failure. They suspect they would be a failure before they even applied, and they're taking it for granted. So they're not submitting the application. Therefore, there's no bin number, and doctors can't prescribe it for medical purposes. And I think that we'll never be able to solve this if we don't change something in this process to allow, well, it's already been proven to have medical benefits, but it seems that there's a gap in the administrative process, and for a few years now, we still don't have a solution a few years later. And I think that this is a gap that needs to be addressed quickly. That's my recommendation if I were in your place.
Sure. So perhaps what I would offer for the committee is that while cannabis for medical purposes has been used, as the other panelists acknowledged, for a very long time, the system that we have in place in Canada, the regulated system of access, has only been around. It was only created at the very end of 2013. So we are 3 years in to the establishment and to growing and developing a licensed industry that's capable of producing quality-controlled cannabis. I think it's reasonable to appreciate that it will take a bit more time. As other panelists have indicated, licensed producers have, in their own right, been funding research in conjunction with universities across the country. We do have, I think, close to 12 universities that are undertaking research, preclinical, clinical, and other research that in the area of cannabis for medical purposes. So it's emerging, it's starting. Perhaps we can give it time to see if it will succeed. The process we have in place for approval of drugs, it works. So I think we can.
Thank you. Yes.
Okay.
Time's up. That completes our first round of 7-minute questions. We'll now go to a round of 5-minute questions, and we're going to start with Ms. Gladue.
Thank you, Chair, and thank you to all of our witnesses. I'm well acquainted with the excellent controls in the medical cannabis regime. Now, a question for Ms. Brogdon. We had a witness last night allege that because of the way we've implemented medical marijuana in Canada, it actually is causing us to violate 3 international treaties. Is that even true?
I guess acknowledge, of course, that Canada is signatory to 3 international conventions, and quite aware of our obligations and take those obligations quite seriously. With this new legislation, I think the government has made pretty clear that its intention is to put public health and safety first. That's why it's seeking to put in place a new, more effective control framework. We recognize, of course, that there will be questions raised about our international obligations. I think our focus right now at this point in time, given that the legislation has only been introduced and the study has just begun in Parliament, which is an important part of our democratic process, our focus right now is on reaching out to those international partners, explaining the content of the legislation, what the government's objectives are, and what it is that we're seeking to do so that that is well understood. And I think that we're also trying to help our partners understand the situation that Canada has in Canada, that exists in Canada today, in terms of youth use, in terms of the illegal market and what that represents. And that is, I think, the focus of our efforts at this point in time.
Okay, so you don't think we're out of compliance now? It's just a question of whether the legislation will complicate that.
I'm not the best person that's not my background, to express an opinion or advise you on whether we are or we aren't in compliance at this point.
Okay. Well, let me switch gears then. One of the things that we've heard consistently is that we need to have public awareness and education on cannabis and on its impacts, and it should be directed at parents, it should be directed at youth. So what is the current status of the development of the public awareness program within the Department of Health and the rollout?
Okay, thank you for that question. So proactive public education and awareness activities, is very important, and the government, considers that a central feature of its approach to protecting health and safety and minimizing the risks of cannabis use. That's why the government made an initial investment in the most recent budget of $9.6 million so that we could begin those public education and awareness activities now. A significant focus of our efforts at this point in time are to reach out to young people and to parents of young people and others who influence them, to encourage them to have conversations about the risks of cannabis use and the dangers to their safety of driving or driving with others who might be impaired.
Specific programs, like are there specific packages that people can access or?
Sure. Well, one good example, which you might have heard about earlier this week, would be from Drug Free Kids Canada. Health Canada has been working with them. They produced a quite excellent guide.
Yeah, we heard about them because
parents.
they've gone to 100,000, I think, parents.
Yes.
That.
Yeah, they have.
Okay.
They have.
What about the young people, the education for them?
Education for them. So we have produced a number of information pieces for them that's available on our website. We've been promoting that through social media since last January with a very high take-up rate through all of the ways that we most commonly kids like to get their information on their mobile devices. So we're very cognizant that we need to do that. We're in the midst of preparing some educational videos now that would be available on YouTube, which is also another way that kids really like to be able to get that kind of information. Really being focused on presenting the facts. We've done some public opinion research on young people and how they like to get information. They really want to have the facts and make up their own mind. They don't want preachy messages. So we're going to make every effort to actually engage youth in the further development of our campaign.
Okay, very good. Thanks. One last question, and this one I think for Ms. Black. So one of the concerns I have is that when recreational cannabis becomes legal, and it sort of looks to me like the same situation that happens when pharmaceutical drugs that used to be behind the counter end up being available in all the pharmacies anywhere, and then health benefit companies quit covering them. Do you think there is a potential for that to happen with medical cannabis?
I'm afraid I don't totally understand your question because cannabis doesn't currently have any coverage. So can you reframe the question for me so I can try to do a better job of answering it?
This is news to me then. So no health benefit company will reimburse.
There's very few. Jonathan is a bit more of an expert in it. There's a small handful of patients across the country that have managed to advocate for themselves to acquire cost coverage for their medical cannabis, but it's very rare, which is why a lot of the recommendations that Jonathan and I are both making are to make systematic changes, including my suggestion that the federal government include medical cannabis in the health plan for your own employees as a leadership initiative, because this is one of the greatest struggles that patients are facing. I mean, there are 2 federal employees in the room today who are going, massively into debt and looking at remortgaging their homes to be able to acquire the amount of medicine that they need.
Okay, very good. Thank you. Got time?
Thank you very much. We'll now go to Ms. Sidhu.
My questions to Ms. Brogdon. You said the cannabis could be classified as a therapeutic product with the drug identification number if a business applies. Is this a hard process to apply for?
Is it a hard process to apply for?
Mm-hmm. We heard from our witnesses earlier there's an educational certificate when they are doing it. Is there any system set up for them when they are applying for that license? Or, I imagine more companies might be willing to do so. They can apply, but is there any system set up there? They have to is educating for the
on how to apply to market a drug in Canada, do you mean?
Yeah, to take a license when they are doing. When they are applying for that.
When they apply for that
license.
So when they're applying to market the drug, I have to say I'm not responsible for that program in particular. So
Is there any educational campaign?
Yeah. To help companies apply? I don't believe so, but I would imagine, I'm almost certain that there would be information available on Health Canada's website about how to apply. to seek a market authorization and the requirements that companies, have to fulfill in submitting the application. I mentioned some of the requirements already, the need for preclinical and clinical studies. So that's the actual research that will demonstrate the efficacy and the quality and the safety of the product. And they also have to provide details on, how it will be produced, how it will be packaged, labeled, and additional information about the therapeutic claims and any side effects of the drugs. So those are the kinds of things they need to submit. But I'm sure that there is information that's available to them, and public servants are usually pretty good at helping people when they need information to apply. So I would imagine that we try to be as helpful as we can.
And I also heard the authorization number and DIN number. So is there any, right now on DIN number, there's a prescription fee. So authorization number, is there any fee available? Like when medicinal marijuana, if they got the DIN number, is there any extra prescription fee will be there?
Okay, so right now under the...
When it's going to be legal after that, I'm talking.
Will there be an additional fee? Maybe I'll answer your question by saying how it is now. So now if a person wishes to access cannabis for medical purposes, they go to their doctor and they get a document which the doctor will fill out, and we provide an example, or we'll take something as long as they give the right information. And that's a medical authorization. So it's not a prescription. As Ms. Black was explaining earlier, a prescription can only be used for a drug that is authorized for sale in Canada, right? So we have an equivalent, which is a document that the doctor signs that clearly indicates how much they're authorized to use, and we'll sign and date that and for what period of time. And that is what an individual would take to a licensed producer to register and then be able to access cannabis.
Next question is the maintain quality control. Is there any recall process in place?
In the event that there's necessary, absolutely. There are rules in the regulations that would give Health Canada the power, if it needed to require a mandatory recall. In most of the instances of recalls that we've seen since the system began, those recalls, when companies discover instances or concerns, they will undertake a voluntary recall. They're quite conscious of their obligations under the regulations and not putting public health and safety at risk, and so they will initiate those recalls, as a precautionary measure. In any instances that we've uncovered through our inspections, that's how it's happened.
So how we can regulate the similar price? Like someone say it's a $4.54 a gram, and we also heard it's a $10 per gram. So how we can regulate the similar price? Is there any system in the place?
Right. In terms of the price prices of licensed producers, so I guess the first thing I would say is that we keep a very close eye on availability, pricing, and the variety of cannabis that's available in the market. Licensed producers are required to report to us, I think David will help me, on a monthly basis. Yeah. On a monthly basis, and it's through that collecting of systematic data and a number of other sources that we keep an eye on what is going on. In terms of the price that's available now from suppliers, the average price is about $9. But licensed producers offer a range of products that can be between $4 and $18 per gram, depending on what the product is and the format in which it is sold.
Thank you.
Thanks very much. Now we go to Dr. Carey.
Thank you very much, Mr. Chair. And again, thank you very much for the witnesses for being here today. Very, very good testimony. And I want to express the importance, like you pointed out, the difference between medicinal marijuana and the recreational marijuana, because I think everybody around the table here, we want to make sure that we ensure the health and safety of Canadians. But many people using medicinal marijuana are very ill. And before this business, I'm a chiropractor, and I saw a lot of people with chronic pain after years of whether it's just non-steroidal anti-inflammatories. they've chosen to move into marijuana with much less side effects and much better results. So there's definitely a really good role here in our healthcare system. But again, looking about the health and safety of Canadians, I know people have brought up home cultivation and quality control inspection. I know Health Canada, even a huge bureaucracy, we've had issues, mentioned recalls. There's been marijuana made available to patients that had fungicides, pesticides, carcinogens in it. And the worry is, even with medicinal marijuana, there seems to be a challenge to make sure that that's inspected and make sure it's safe. So I wanted to ask you about homegrown and about quality control, because really, how do you manage that? And should there be, or is there a difference between home growing for medicinal use and home growing for recreational use? Do you have comments on that?
So in terms of medicinal use, we definitely have comments. Health Canada has taken steps over the past 6 months or year or so to allow patients who are authorized to home grow to be able to submit their products to a lab for testing. Of course, there's issues with affordability. Testing at a lab is difficult for patients, and lots of people are producing at home because of affordability, so it's inaccessible in lots of ways, even though we do commend them for taking that step, because before patients had no testing abilities. And in terms of the health and safety risks, I would say that lots of this, as we move out of prohibition, should fall under bylaws, safety codes, those kinds of things, to ensure people are having safe wirings, but and no fire risk. But it definitely can be done safely. It just, people need to have proper education on how to do so.
All right, Madame Black, do you have a comment on that or no?
No, I think Jonathan covered it.
That one of the things we've heard, we heard from Colorado, and when we're talking about recreational use. The comment was made when we did it, we're like flying a plane while building it. And one of the things they asked us to do, or advised us to do, is not to do the same, slow down, make sure that you get it right. They recommended that we have things in place like public education, baseline data and data collection abilities, treatment research. And I notice in your recommendations, both of you are recommending more money for research. And really, with 288 days, a lot of the witnesses are kind of wondering, is this an opportunity lost? I was wondering if you could comment, because you are on the ground, you're helping patients. Do you have access to programs through Health Canada or the government if you're trying to educate your patients? If it's anything from how to do a proper homegrown, for example, or how to utilize it? Data collection, so that when you're dealing with patients, you can actually say patient A has had, vaporized marijuana versus smoked marijuana versus edible marijuana. What are the dosages? What kind of effects are out there? And looking at this as a baseline so that the recreational market can utilize that data and make sure that it's even safer labeling and recommendations moving forward. Are you guys having access to those type of programs or funds right at this time?
So at this time for the Compassion Club, no, we've been engaged in civil disobedience for 20 years. And so we don't engage in official research with the government in any way. We don't receive any kind of government subsidies. And just speaking of subsidies, I just want to segue a little bit to just let you know that the employees at the Compassion Club generally earn less than $25,000 a year. So, we're talking about people that are really working for very little to provide these additional healthcare services. In terms of data collection, because we haven't had access to cannabinoid testing, we haven't been able to collect data that will give us correlations between cannabinoid profiles and symptom management. What we are able to do within our own, sort of little bubble is that we keep immaculate records of what the clients are consuming. So anything that a patient is consuming, we know all the way back until if they registered with us 18 years ago, we have a profile on them of every single thing, every time they ever procured something from us. And if they have any feedback for us about what worked for them or what didn't work, it can get put down in their patient profile. Now, we haven't, brought all of that data together, but we've been creating it in a way that we can really create specialized patient service on a one-on-one basis. But I would say that we are an organization that is ripe for working with a research organization. Having the huge patient base and the incredible amount of experience that we have.
I think you have valuable experience there, and like I said, there's 288 days left before this moves in. And it's just, I think you would agree then with Colorado, it would be good if we had these resources and baseline data available as we move forward, eh?
Well, and I think even more so than data, what's important is the common sense education around maximizing benefits and minimizing risk.
Yes.
And that's a place where we have a tremendous body of knowledge, and there are, pretty simple recommendations that you can give people around how to avoid adverse effects with ingesting cannabis, how to make sure you're not driving impaired, how to make sure that you're not operating machinery while impaired. These are things that we have been navigating for 20 years.
Thank you.
Okay, now we go to Mr. Oliver.
Thank you very much. The questioning, Ms. Bogdan, around, we heard from witness after witness after witness. It's been a long journey since we saw you Monday morning, but the importance of public education on this and getting it going now is absolutely paramount. So it's great to hear the initiatives that are there, and you're right, there was a very good presentation from the one group, and they had produced quite an excellent document, which I'm going to take home with me and use, because the way they had you speaking to youth about marijuana was a very thoughtful approach. So thank you for that. Bill C45 is quiet, though, on public education. Some jurisdictions, I think, suggested that they were sort of mandated to take a percentage of the proceeds from the sale of marijuana or cannabis for education. Are you happy with C45 as it is now? And I guess the educational component, the public health message, resides elsewhere in the health department and will be a continuing, ongoing strategy for health, or does it need to be in the bill itself, do you think?
Thank you for that question. As I said in the answer to a question from another member, the public education is a very important part of the government strategy. Taking a public health approach to cannabis or tobacco is about maximizing public education and minimizing the risks of use. So, in answer to my question of one of the other honourable members, I talked about, sort of the work that we have underway now, right, to talk to young Canadians about cannabis use, make sure that they're thinking about the health risks. That's the part of the work that we're doing now. Our work will turn in the weeks and months ahead, planning for the prospective, if this bill is passed by Parliament, to do as other members have suggested and other witnesses before this committee, and perhaps working, in concert with other partners who have this to get additional information out.
I'd encourage you, whether the bill passes or not, given the prevalence of the use of marijuana in youth, the more you're doing and health is doing, getting those public messages out, the better. And the sooner and the more, the better. I just wanted to change. So I understand from the BC Compassion Club Society, their recommendation number 5, that edibles are not illegal, are not yet a permitted form from the licensed manufacturers. Is that right?
Licensed producers are able to distribute cannabis oil that is not for inhalation, but that is used for consumption.
Yes.
So you can take the oil directly
So you can buy the
on
oil
a
in
spoon
man-
or a syringe, or you can take it home and produce baked goods out of it.
But in terms of some of the other things we've heard from other jurisdictions, like Colorado, where there's quite a robust
No,
market.
when we talk about edible products other than infused oils, they are not currently allowed from the licensed producers.
So one of the concerns, this has been a very prevalent concern raised by witnesses, that edibles should be part of Bill C45, for some very good public health reasons. One, because otherwise people are primarily going to be smoking and inhaling, and because the black market or the other market has competing goods in this area. So what we heard, I think, on Monday was that it was too soon, that the experience from Colorado was that launching edibles would take some time, and there was complex regulation, so it wasn't included. But it's been 3 years now, and I'm sure that the medical marijuana users have been advocating for, manufactured edibles for some time now, for 3 or 4 years. So it leads me to wonder, what's happened? Like, why hasn't health addressed this? Or you just don't think it's an important component of the market? Or like, why haven't you addressed it for the medical marijuana group, and then you would have had the regulations and things ready for recreational?
I guess what I would offer is that the enabling the production of cannabis oil, when the licensed industry first began, it was only for dried cannabis. And enabling licensed producers to begin producing cannabis oil is a relatively recent feature of the system, addition to the system, in part in response to a federal court decision. It would be the summer of 2015, I believe. A year before I started this job, if I got that right. So we have really focused on, we put those regulations in place, which allow producers to produce cannabis oil, as Ms. Black mentioned, in a variety of different forms, and have been working with those who are interested in increasing the supply of that. So I think that has really been a focus, is, enabling those licensed producers that want to increase that.
But I think you'd agree that Colorado, I know you've been down there, they have an incredibly diverse range of edible products.
Absolutely.
And why haven't you allowed that to develop, or why hasn't Health Canada come out with guidelines around that for at least the medical marijuana consumption?
Well, as I said, we haven't contemplated, authorizing a broader range of products.
And why is that?
Why is that? I think we were focused on enabling, the cannabis oil. And building that industry, putting those regulations in place. We were focused on that. Our minds might have turned to looking at other products. And then with the change of government and a commitment to legalize and strictly regulate it, I think we've put some energy and attention into that, supporting the government on that.
So there's no other reason why you wouldn't be proceeding with edible products, then? There's no other... No,
absolutely not. I mean, that is, I think we recognize, as many of the witnesses before this committee have this week, that we should be doing everything possible to enable people to consume cannabis in ways that will be safer methods of consumption, and will minimize the harms. That is why this legislation contemplates bringing into force regulations for products, such as edibles or concentrates and other things. I think, so that's contemplated by this bill.
Great. Thank you very much.
Sorry.
Mr. Davies. Well, Ms. Bogdan, the curiosity to me is that, yes, the legislation contemplates edibles, but it doesn't legalize it. And we're the Health Committee, you're the ADM of Health. Is it not the case that smoking cannabis is the least healthy way of ingesting cannabis?
Absolutely. Absolutely.
Yet, ironically, that's C45. The focus of it is to break out, first and foremost, smoking cannabis, which is the least healthy way to do it, and leaving edibles and other products that are many patients prefer because they don't have to smoke. We're leaving that for a future day down the road. That strikes me as perverse from a health point of view.
So. Could I respond to that?
Yes, please.
Okay.
Yeah.
So the legislation contemplates a range of products. When the legislation comes into force, there will be both dried, which, as some of the panelists here today have acknowledged, people are consuming it by vaporizing and things like that. But more importantly, it will also enable people to access cannabis oil, which is produced under strict regulated circumstances. You can ingest it either by drinking it. You can put it in your tea. People can bake it into baked goods. There are many different ways that they consume it. But it's very important that as of next July, people will have access to a regulated, quality-controlled supply of cannabis oil, which is a healthier way to, if they choose to ingest it, if they choose to use cannabis, a healthier way to do that.
My understanding is that the problems with the oil when it comes to vaping is that the THC percentage of 3% mean that vaporizing that THC at that concentration is not sufficient to give people the concentration of THC that they'll need. And the other thing, of course, is by leaving that oil to be produced by Canadians, I guess, in their kitchens, we really don't control then the mold and the sanitation and the concentration and dosage, the child-proof containers that those products may end up in, I guess is my point. But
Could I respond to that,
I'm going to
Mr.
just
Chair?
turn, Ms. Bogdan, because I want to have a couple of questions for Ms. Black in my limited time. Ms. Black, I wanted to ask you about advertising. One of your recommendations is to ensure that advertising restrictions do not unduly limit the capacity for service providers to provide education and convey product characteristics and help instill consumer confidence in this new regulation. Now, we've heard some testimony that really sets a very, very dire message, this committee, about advertising. And, you know, we don't want it in sports facilities. We don't want it on billboards. We don't want to convey lifestyle advertising. I understand that. What is your testimony? What do you mean by your recommendation?
Thank you for the question. Before I answer it, may I clarify something for your previous question?
Yes.
So the restrictions, as I understand them, I just want to be clear that the restrictions in the oils that are currently available, they're not for vaporizing. So those are for ingestion only. I also just wanted to make a comment that we sort of like that. Inhalation is a very important mode of administration, and it can be done very safely when a vaporizer is used properly. I want to make sure that we're not demonizing it in terms of patients. Using inhalation and the immediate onset of symptom relief is very important. My understanding is that the restrictions in the ACMPR currently is 30 milligrams of THC per milliliter. I'm not quite sure where the 3% number came from, and 30 milligrams of THC is quite a lot. When I'm teaching patients how to use cannabis for the first time, if they're using oil, I have them start with 2.5 milligrams and wait till the next day before they increase it. So I just wanted to clarify that. In terms of advertising, I mean, from the Compassion Club perspective, we would like to be able to do more patient outreach. We have always worked very hard to be compliant with every bylaw, every little law we can possibly be compliant with while we break the big ones. So we don't do any patient outreach into other patient groups that could really benefit from our services because we don't want to be contravening any of the advertising regulations. 2 years ago, we received a letter from Health Canada that was fairly heavy-handed in terms of informing us that the menu that we had on our website and on our telephone line, that if we didn't immediately cease and desist, there was going to be $1 million worth of fines and years in jail. And so we immediately complied. So most of the other unregulated dispensaries in Vancouver and the online ones have not complied in the same way that we have. And as a result, we are losing revenue quite significantly, which is impacting our ability to provide patient services. And I would suggest that the same thing will happen for the legal market. If the legal market is handcuffed in terms of being able to talk about the effects of the products, or to be able to talk about the qualities of the products, or even the nature of the company who has produced them, that you're going to give a substantial advantage to players that are producing cannabis in an unregulated market.
Thank you. Just quickly, so is oh,
sorry, time's up. But I do want to give Ms. Bogdan a chance to answer a question. I think you wanted to make a comment a while ago.
Actually, I think Ms. Black provided the precision that I wanted to. That the cannabis oil is quality controlled and it's actually ingested. It wouldn't be inhaled. That people are available, and the 30 milligrams per milliliter, and that is actually a significant quality controlled dose that would be available.
That brings to an end our normal circuit of questions. But I had a question for Ms. Black. What, in your opinion, why will nobody apply to have medical marijuana listed and assigned a number?
So this is not my area of expertise, but from a layperson, my understanding is that when you are applying for a drug approval status and you have to go through human clinical trials, that you have to do that with each individual active ingredient in the medicine that you're looking to get approval for. So cannabis has over 80 active cannabinoids, and then there's a whole other class of active ingredients called terpenoids or terpenes, which are responsible for the flavor and the smell that distinguish the strains. But we're starting to understand, emerging evidence is showing us that the terpenes also interact with our endocannabinoid system and have therapeutic effects. So my understanding is that cannabis is a very complex plant. plant, and it doesn't fit easily into the pathway of the way that we regulate pharmaceutical medicines, which are often single active ingredients. So it's a plant, it has many of these different active ingredients, and again, not my area of expertise, but I also understand that you have to go through clinical trials for each one of the indications that you're looking for approval for, and cannabis is used for such an incredibly wide range of symptoms.
Okay, thanks
So
very much.
maybe we'll be able to put our heads together and see if we can come up with a solution and find a way forward.
Well, if we can help you, we'd like to do that. Now, I'm getting all kinds of signals from over here, hand signals and...
You know what I'm going to say. We have some time remaining, and so I would like to seek unanimous consent. Now, here's the twist, to have each party have 5 minutes to ask questions.
Each party to have 5 minutes to ask questions. Well, if you want to, we'll go back to the original round one, which is 5-minute questions.
I would accept that amendment.
Is there unanimous consent? No unanimous consent, so we can't.
All right.
All right, well, that brings to a close our meeting, and again, I want to, on behalf of the committee, you're great witnesses, and I especially want to thank Mr. Zaid and Madame Elisma for sharing your personal stories with us, because these are the stories that really mean something to us, and you've made a difference. You've made a difference here by coming today and testifying, so I want to thank you all for your testimony on behalf of all the members of the committee. So I hereby suspend the meeting. And when do we come back?
1:45.
1:45, we're back.
But
Only
if you, I